Arlington County Board is back in a session regarding the fiscal year budget, one of our work sessions. And today is our 7th as we review the fiscal year 2022 proposed budget from the manager and work on finalizing that budget over the coming weeks and month. Thank you to everyone who has joined us. Our topics for today are compensation and capital funds. I'd like to remind everyone watching that the presentations being seen today are available online, as is the entire proposed budget. Today, first, we will hear from Human Resources about compensation, followed by representatives of the Human Rights Commission, and we'll go to Manager Schwartz, for the introductions.
Thank you, Mr. Chair. As you noted, this is the 7th session we've had. It is the last one we have where we'll be going over in any detailed county programs. So we're going to hand it over to Marcy, but I wanted to have one preface before I handed it over to her, which is that we have received additional funding, as we've all noticed, under the American Rescue Act, and I will have some recommendations. I know a number of employees are tuning in, expecting somehow today there would be a big announcement about what additional compensation there would be. That is not what this work session is about. This work session is going through the very detailed set of recommendations that were made in the proposed budget and a number of enhancements of some programs there. So with that, I'll turn it over to Marcy Foster. Thank you.
Good afternoon, everyone. I am Marcy Foster, the Human Resources Director, and I have some of my staff here. So if they don't mind, I can get them to turn on their camera and you'll put a face and a name together. First off, I have Luan Hung, who's responsible for HRIS, the administrative program and the safety program for the county. Jason Drake, who handles employee relations and training and organizational development. Tamara Galliani, who handles compensation and recruitment. Kristen Young handles payroll and employee benefits. And Tiffany Noon, she may be driving the slide deck. All the employee communications, or you've seen Tiffany's hand in some of that. So thanks to all of them and all the people behind the scenes that have been working on this. But this is the manager's proposal for compensation for fiscal year 22. Tiffany, can you share the slides? Okay, next slide. So on our first slide, I have the HR department mission, and what we really want to do is put together great programs and offerings so that we can attract, retain, and develop a diverse and high-performing workforce. The total compensation philosophy was approved by the board back in 2018, and the total compensation philosophy ensures that we recognize that our employees are the foundation of our success, and we strive to offer meaningful, well-rounded total compensation package that provides employees with fair, competitive pay, benefits, and retirement options. In the proposed budget for fiscal year 22, there is no merit-based pay increase, so nothing going to employees' base, but proposal of a $500 net bonus. And so that means each employee would get in their check $500. All the taxes would be taken care of. So the value of a $500 net is roughly $850 gross. The manager is also proposing taking the living wage from $15 an hour to $17 an hour, and this would assist about 50 or 70 of the current county staff, primarily facility assistants, rec assistants. Some of our lowest paid employees would be getting a pay increase under his proposal, and then this would also put us as a leader in this region in the living wage. The surrounding jurisdictions have something in the neighborhood of $15 an hour. There'll be no premium increases on our Cigna or Delta Dental program, and there'll be a premium decrease on our Kaiser program. This year, we rolled out for the first time a consumer-driven health plan. We're a little slow and methodical. Consumer-driven health plans have been around for a long time. Private sector was first to jump on board. but all of our surrounding jurisdictions, Alexandria, Fairfax, Loudoun, have been offering them for a number of years. So it's a great program that gives employees some lower premium options. And so they can save a little bit of money, and what they save in those premiums, they can put in an investment vehicle that would accumulate over their career here. The county would also match some of the dollars they put into that investment vehicle. So they have the money to meet the high deductible that comes with a consumer-driven plan should they need to. And if they don't spend all the dollars in their health savings account, it rolls forward for future use. We did not implement it July 1 like we had hoped to because we thought COVID was a little distracting at that time. We went forward in July of this year, so our enrollment is really quite low. I think most of the other jurisdictions are probably in the neighborhood of 10%, if not higher. But we hope to do a little bit more marketing in the spring to get that number up July 1 because it is a low-cost option for employees with all the same participation at the doctor level, so they're not struggling to find the provider that they need. It's really a great plan if we can get people engaged and get a discussion going for that. And looking at the health plans, just to give you an idea so you can see where this one stacks up and a little lower in cost. The co-insurance plan is the one we rolled out a couple of years ago where you pay a percentage of the cost. So if you're visiting a doctor, you're going to pay 10% of the cost. The county will pick up 90% of the cost. The co-pay is where you pay the flat dollar amount. So you're paying a flat dollar amount, a $30 co-pay to see your physician. The county would pick up the balance of that cost. And the Choice Plus is the plan I just mentioned. So it's the one that has the investment vehicle next to it, but it has a high deductible. So employees have lower premiums if they never use the expenses in the plan. They may not ever hit the deductible, and they have that savings vehicle build up. And then Kaiser has been around as long as we've had our health program here. So it's your typical Kaiser facility. You must get your services at Kaiser. So this shows you that there are no deductibles other than that high deductible plan. And it shows you the premium reduction in that plan and the contribution to the HSA, which is the investment vehicle that rolls forward every year. The manager is also proposing some enhancements to existing programs, so taking our paid parental leave from 6 weeks to 8 weeks. We were first in the region to put this program into effect a couple of years ago. Everybody else has caught up with us, so we're moving ours ahead a little bit, back up to 8 weeks. Our dependent care reimbursement account is your typical dependent care reimbursement account where years ago employees would put dollars into that account and then use it to pay for childcare or summer camp, and those dollars would come out of their paycheck pre-tax. In this case, the county is putting the first $1,500 in the proposed plan in. The employees can put the balance in that program pre-tax. So it kind of funds some of their child care expenses, and the employees can pay for the balance on a pre-tax basis. Increasing our tuition reimbursement program from $1,900 to $2,200. This program is highly utilized by probably more of our lower paid employees, so it's getting some more dollars into the hands of employees who want to take some college level courses. And then the manager added Juneteenth as a paid holiday, and the first one will be in this fiscal year. I think it's the last day of this fiscal year, but it will carry forward every year hereafter. Live Where You Work grants. We were also the first to offer those way back, probably about 20 years ago. We went to the state that got to get the authority to do that. This year, there's increased funding for that program, and we will venture away from the straight dollar figure for rentals and straight dollar figure for purchases to a staggered dollar level depending on the employee's actual earnings. We don't have the structure ready just yet, but those earning less will get a greater grant from the program. And we've increased our volunteer leave for employees who'd like to volunteer out in the community from 8 hours to 16 hours, allowing them to use half of those hours in their own home community, because there's a lot of requests to volunteer where they live. So the first 8 hours would be in Arlington, the next 8 hours would be in their home community. And for the last couple of years, we've been working on the compensation maintenance plan, where we look at all of our job classes in comparison to job classes in our competitors. So we look at Fairfax, we look at Alexandria, we look at Prince William, and we also look at some private sector entities or some other entities that employees are saying that are our competition. So for water pollution or the wastewater treatment plant, we might bring in some of the other wastewater facilities that we are aware of. So we want to make sure we have competitive wages and that employees have job growth opportunities. So it looks at our ranges as well as the wages we're paying. And if we feel like we're off market, we move those ranges so there's future pay opportunities for them, and we give them a 5% bump. So we've been working on this for a number of years. We hope to have it done in 4. We're kind of looking at year 5 and year 6 now. COVID kind of slowed us down and the funding wasn't readily available for us, but we are completing a few job studies this year, and we've got plans to wrap it up in the next year or 2. So all of our job families will be looked at for competitiveness. Sadly, after year 6, we may have to start all over again, because while we're doing this, our competitors are doing the exact same thing. So even though we might be moving our ranges, they'll continue to move their ranges. And Prince William last year did some huge changes in their compensation program. So we find ourselves falling behind already. So we'll probably take a short breather and start it back up again, because despite COVID and what's going on, this is still a highly competitive region to get the right workers into the workplace. We show you this chart every year so you can see some changes, some improvements being made, and then you can see where we're starting to fall off again. So we always look at our classes and are they lagging at the maximum? So the maximum is where you get pay future. So when employees hit the top, they might become dissatisfied, they might be looking for other jobs, and we want to make sure there's still an opportunity to increase your pay. So you can see through the course of the job studies, we've made some improvement in fiscal year 20, but we're going to drop again in fiscal year 21, primarily due to what Prince William did to their pay plan. We always look at employees hired over midpoint, other than some jobs like public safety where they start at entry. Most of our employees come in at mid-level or higher. And so the higher they come in, the less job future they have here, or they feel they have here, if we don't keep moving those ranges. It's been pretty relatively flat. It did take a dip in 2019, but it's been really relatively flat in the last couple of years. But you can see the MAP programs, the management accountability programs, which are maybe more your executive level jobs, we are always bringing those staff in at the top. It is hard to recruit from other areas at the director level or the deputy director level, so we are bringing them in at the maximum pay. Turnover, I guess good news on the turnover front, it's slowed down a little bit. It's been pretty consistent in the 10 to 11% range. This year you can see employees are not leaving as quickly, not retiring as quickly. The current situation has slowed the exit from the organization. 10% is pretty normal in any organization, so no huge concerns, but our employees are sticking around a little bit more than normal this year. And again, employees at the max, employees that are going to hit the maximum of their pay range, has been pretty flat. It's going down a little bit because we've been doing a decent job at moving our pay ranges. So we have to stay on top of that to make sure that they don't hit the max like they were in the past. What's going on in the region from the pay perspective? Arlington, we talked about the bonus, the net $500. Part-time employees would get half of that. Alexandria is sticking with their grade and step plan. This is the plan we had years ago. So the lower grades would be getting 5% increases and their higher grades would be getting 2.3, and it varies in the middle. Fairfax has none proposed. Loudoun and Prince William have 3% pay increases for their staff. Proposed premium increases for health plans across the region. Good news on the health plan front. I think COVID slowed everybody from going to the doctors for a little bit, so there's been some savings on the health plan. And so employers are not passing on premium increases. So you can see Arlington and Alexandria is at 0. Fairfax and Prince William are both around 5%, which is a low premium increase, historically. We have very similarly structured plans. So our individuals pay about 20% of the cost and our families pay about 25%. Slightly different cost sharing in Fairfax and Prince William. We put the retirement chart in there. We haven't shown that in a long time, but it's still good news. There's not a lot of changes going on in retirement. So this first chart is for general employees. There will be a chart for public safety coming up next, but you can see our multiplier is at 1.7, pretty strong in the region. Fairfax does, for new hires, have a 2% plan. We average our pay. So when we calculate our benefit, we average it over our 3 highest years. Some of the other jurisdictions have been making some changes there, and they're averaging their calculations over 5 years. So the bigger number of years you average your calculation over, the smaller your benefit gets. So again, Arlington's offering one of the better programs there. Our employees contribute pretty much 4% across the board. You can see Fairfax contributes a little bit more. Some of the other jurisdictions have defined contribution plans like Prince William, where their employees put a small contribution into that plan as well. And you can see our normal retirement age here is 62 and 5. And we have a rule of 80. So when your age and service total 80, you can also retire. Pretty similar across the region, a rule of 90 in Alexandria, a rule of 85 in Fairfax, a rule of 90 in Prince William. Again, we're probably in the better side of that column as well. And we do offer additional defined contribution plans. So for general employees, the county puts 4.2% of their pay in a defined contribution plan. Employees are allowed to contribute pre-tax to the 457 plan, where we have a small match. You can see other jurisdictions all offer the 457 plan, and some of them have a small defined contribution plan with the exception of Fairfax. This is the comparison for public safety, where again, think we are very strong. Our multiplier is 2.7 in comparison to 2.5 in Alexandria and Fairfax. Slightly higher for police in Fairfax, but police in Fairfax do not participate in Social Security Administration. And Prince William is part of VRS, so they have a unique system there, a unique multiplier. You can see, the average wages. We again have the lowest average wage for calculations, which is good news. Our employees contribute less, with the exception of Fairfax. More good news. Our retirement age is on the low end of things. We're at 52 and 5. Where most other jurisdictions are at 55. So I think we're in good shape there. And all of them are offered a 457 plan as well. And we do have Retiree Health. Again, good news for the Arlington County retirees. We currently subsidize our program at $300 a month. Alexandria is at $260, Fairfax is at $230, and Prince William participating in VRS is at $45. It's based on your years of service. So our across the board, other than VRS, are at 25 years of service as the max that we recognize. So anybody who works 26 or 27 will get the same $300 from the county. We supplement it with a Medicare Advantage program, so there's some cost savings there. And in Arlington, if you were to retire from Arlington, go work in another employer, you don't have to take medical at that point in time. You can get on another employer plan, enjoy that plan, save us a few dollars. And if you were entitled to take the retiree medical when you left, you can come back and get on our plan at that time. So a lot of public safety staff might retire early, might go work somewhere else, get another 5 or 10 years in somewhere else and use another health plan, and then come back and use our retiree medical at that point in time. So it's like a win-win for both of us. And there's some notes that in Prince William and Alexandria, they are just reimbursement programs. They are not keeping those employees on their group plan. So it's just dollars that they can use to go buy a program somewhere else. Arlington and Fairfax, we keep them on our group plan. Talk about commitment to equity. We have some statistics on training and development. If all things going bad during COVID, great numbers on training and development. When employees went off-site, did telework, perhaps had some more free time on their hands, the training and development numbers shot way up. So we had a 250% increase in online courses. We had a 44% increase in people of color accessing online training. And DES employees overall pretty much doubled their commitment to online training. So with employees having a little bit more time available, they took advantage of it. So they did a lot of unconscious bias training, race and equity training, how to work remotely training. So there's a cadre of courses that are available 24/7 online, in addition to some programs that we put online that are being offered by a consultant or HR staff that they would take at a set time. There's a whole group that they could take at any time should they want to. So this is the program we're reflecting here, a lot of our online courses. From a recruitment standpoint, we looked at some statistics to share, and we see an increase in females in the MAP program. So again, the MAP program is like division chief and up. So increasing over the last couple of years in females and increasing in minorities. That doesn't mean we're going to take our foot off the gas. We're going to stay on top of it, but some positive numbers to share there. We are focused on reaching out to veterans and veterans with disabilities. We went out and got a certification to participate in their program. So hopefully that will reap great rewards as well. And we no longer ask for pay information. A few years ago, we stopped asking for pay information for new hires. We used to ask them to submit their pay stub to make sure that they were coming in at the right place on the pay line. That can detract from people who took some time out of the workforce. So a new mom who might have taken some time off doesn't have a current pay stub. So we want to pay you for the job you're doing and the skills you're bringing to the table. So we no longer ask for that information. And what do we have coming down the road? Continuing on that comp maintenance plan so we can get through the years 5 and 6 and make sure we get everybody a fresh look at, are they being paid at market? Looking at our promotional pay policies to make sure that internal promotions are compensated as well as if we were to bring somebody in from the outside. And look at our current pay for any compression. That also happens when somebody comes in from the outside. A tight market, we might have to bring them in a little higher. We want to make sure our internal staff are compensated fairly as well. In the benefits world, they are going to put out a lot of RFPs. Those are just time consuming in nature, so there'll be a lot going on there. We may be offering some different programs or plan designs based on how that shakes out. And they'll continue to push that consumer-driven health plan so we can get those numbers up, because they're great programs and low-cost programs for employees if they understand and are willing to give them a try. And then for equity, diversity, and inclusion, we're going to expand a pilot that we've been doing where we give you blind applications. So we redact names, universities, anything that might be leading towards your race or ethnicity, and see if we cannot do it electronically yet. So we may have to be looking at how we can do that electronically going forward. Continuing all our training, continuing the unconscious bias training, continuing to look at recommendations and the barrier analysis and what can we implement to make this a better workplace. And then look at continuing offering training in that 24/7 opportunity and focus on more programs that are based on diversity, equity, and inclusion. And that is the end of the presentation. I am happy to answer any questions you might have.
Thank you, Ms. Foster. We'll get to questions shortly. We had 2 commissions that might be able to speak, and no problem. The first is the Civil Service Commission, and we had our representative Nancy Anderson here. I don't believe Ms. Anderson is here any longer, but I'm giving Ms. Anderson, are you there? Okay, so she did share with us and for our public. I'll just provide a short summary of her thoughts, and it's 3 or 4 sentences, so bear with me, colleagues. It's Civil Service Commission's thoughts. And Ms. Anderson emailed this. She was juggling a few things, did want to provide these comments. The Civil Service Commission reviewed the budget pertaining to Arlington County employee compensation and benefits. We were supportive of the changes to benefits, an example of paid paternity leave, tuition reimbursement, and housing grants. In terms of compensation as a result of the receipt of federal funds, if possible, we, and that would be the Civil Service Commission, recommend the funds be used for salary increases versus a one-time bonus because of the long-term benefits to the employees, as well as the ability of the county to be competitive with neighboring jurisdictions. So that's just so all of us are aware of what was shared by our Civil Service Commission. And now we will hear from the other relevant commission at this point, which is our Human Rights Commission. And I believe it's Helen Ann Connolly. Ms. Connolly, are you here?
I'm here. Good afternoon, everyone.
Good afternoon.
Thank you so much. Well, it's a pleasure to appear before all of you today. I'm delighted to be serving this year in the chair of the Human Rights Commission. As I hope everybody knows, we're sort of riding the wave of some momentum of some really good accomplishments from the past year, including the commission submitting to you, the board, some proposed changes to the Human Rights Ordinance, which candidly was sort of long in coming, to sort of bring that ordinance to current. If we look at what some other jurisdictions are doing from a legislative perspective. The other kind of momentum wave that we're riding is last year, the county's attainment of a perfect score on the Municipality Equality Index. So our goal as a commission this kind of term this year is to carry all of that good work forward. And so, as a commission, we're sort of laser focused with the Office of Human Rights on a couple of really strategic goals, including maintaining that 100% score on the MEI. And what's actually interesting on the MEI is you can actually over attain 100%. And so, of course, we want to do that, right? Our goal is 110 points this year if we can get to it. And to be positioned to do that, we'd like to see the county board do two things this year. Number one, approve an anti-bullying policy for the benefit of county facilities. And number two, implement some kind of policy recommendation that would require your contractors and your vendors in the procurement process to demonstrate that they have EEO policies for the benefit of their own workforce. Another sort of initiative that the commission is laser focused on this year is the affirmative action plan. As folks on this call, I believe, know, we are behind where we should be on an affirmative action plan. There has not been a current plan in place since 2018, and we need to fix that. And so our goal is to work with the Office of Human Rights to get that current and get that in a form that it should be in. Now, the county has done some really good work this past year in hiring a vendor to conduct a barrier analysis, and that was really excellent work. And I understand that that vendor is working with HR right now to implement some of those recommendations to overcome some of those barriers to employment opportunity, which is awesome. The work on the affirmative action plan is still underway. Now, for the first time, the county has leveraged the use of a vendor, which is great, and we're glad to see it, but the work is not done. And I understand that the vendor is on contract, I think, through the end of the summer. So as you are reflecting on budget and where you need a little bit of room for the Office of Human Rights, certainly we have 3 years worth of affirmative action plans to implement, and we only have a handful of months left on this contract. So I want you to be thinking about, what might it take to either extend that vendor to get that work done, or to re-engage a subsequent vendor if that's needed, so that we can get our compliance house in order on the affirmative action plan. Kind of the third strategic initiative that we're focused on, which dovetails with Ms. Foster's overview on sort of training initiatives is really the work that you all have articulated in the budget around race and equity. And we are, as a commission, so supportive of that effort. And we're looking forward to partnering with the race and equity officer and lending what expertise we as a commission have, right, around policy and training recommendations on how the company can combat some of these issues, both internal to the workforce as well as to the community at large. And I can tell you one of the things that we're thinking about as a body is some perhaps enhancements that could be done to those training initiatives that Ms. Foster just described, including training initiatives for those individuals who are public facing, like police. We're really glad to hear that there is implicit bias training underway. We think there's more work to be done to enhance those really important issues in our community. So net, really supportive of the budget and the work that is to be done, but really a lot of work still left to do. So just want to make sure there's room on training and affirmative action plan vendor in your budget discussions.
Thank you, Ms. Connolly. I appreciate the update and highlighting the key areas for further questions and follow-up as we're working on the budget. With that, we'll open the floor to questions from colleagues and or either of the manager, our commissions, or Ms. Foster. And we will go ahead. I will go ahead and actually get us started with a question that it could be for follow-up. This question is, we had it's around the last point that Ms. Connolly made, but it's sort of linked. I think it may be partly for the manager. It's regarding a question of, it's related, but it's a question on sort of budgeting process and race and equity. And we had a question about that came from our Destination 2027 individuals, and it would apply both to compensation, but more broadly. And I guess for the manager, just wanted to see if, as we're constructing budgets with respect to compensation, is there, and this could also be for Ms. Foster, is there expertise that can help us build equity-based budgets? And this really it's slightly different, but it was kind of triggered by Ms. Connolly's comments. And I don't know, Mr. Manager, if budgeting that is sort of narrowly equity focused with metrics is the email that we received. And I didn't know if that's something we could follow up on, or if you could speak to briefly.
Yeah, let me start out, and then I don't know if Marcy wants to add anything, or we have Samia Bird is online, as well as Richard Stevenson and the DMF staff. You can remember, I hope we can all remember back to the last sort of large work session we had before the pandemic, when we had Mayor Landrieu come in and talk about how you do budgeting and a municipal budget for equity issues. And we have continued our work with that group. And I know that Ms. Crystal, for example, is working with UNUM to follow up on some of the issues related to how we can bring equity principles into part of our budgeting. It is, and I saw Trish Rogers and Abby Raphael's letter, and they raise a number of really important questions. I'm still not convinced that there is a municipal jurisdiction in the United States that has actually figured this out in a way that doesn't show room for improvement or creativity or experimentation, and that's what we're doing right now. There's a number of places where we've talked about equity and equity principles, and specifically on compensation. One of the reasons why we focused on doing a bonus with our limited funds was that has an impact on those at the lower end of the pay scale. And the proposal to go from $15 to $17 an hour was to take some of our limited dollars and also focus on those people who are at the lower end of the pay scale. Now that's as to employees. As to the budget overall, I'm sure other people may have comments. I'll let Marcy weigh in, or Samia, anybody who would like to add comments on that.
Great. Ms. Foster, did you want to add, or Ms. Bird? While I can just say that the email we received had sort of a couple of specific thoughts around, the history of budgeting, as I think of it, is often built on last year's amount and strategic objectives. And this is thinking sort of metrics based on equity is a new way of thinking. And so that's part of, whether there's any benefit there is kind of the question, one of the questions that was asked. But Ms. Foster or Ms. Bird?
Samia, I see you popped up. You might be ready to take this. I can talk about the HR side of it, but not the budget side of it. So you want to start, Samia?
I was going to say about the big picture and kind of broader budgeting side of it. It is something that we have talked about and we've been talking about and looking at what some other jurisdictions have done. I think where we started with the equity resolution is a great place to continue to build on and asking those questions and thinking about them more broadly in terms of how we are allocating our resources, not just getting down to the weeds of specific programs, but when we look at those programs in totality and how we've made decisions, what does that say about, equity in our budget process and in terms of our values? So what you're really talking about is growing to a place where we're looking at almost a values-based budgeting kind of process, if you will. And I think that's going to take time, and that's someplace that we're going to have to grow to. Just getting people to even start to think in those ways more broadly is going to be an initial first step. And a lot of that starts with the educating and those initial conversations we've been having. So I think we're going to grow to that place, but it will be something that's going to take time.
Great, thanks. And I will say that part of the thought was maybe if there are experts who could add strategic value consulting services in modest amounts, I thought that was part of the question. So that may sound a little more hopeful in additional resources as opposed to asking you to do more. That was one. And then there's sort of a communications community validators piece. But I want to make sure we also hear from Ms. Foster on this.
So I think a few of the things we touched on during the presentation shows that we have a focus on getting the dollars aligned differently to focus on equity. And so we're collecting statistics that will show us where we need to spend those dollars best. So obviously, if there's more dollars, we can do more, or we could do it more quickly. We have talked about consultants to help us look at some of the pay pieces. They'd be quite expensive. So I think if we get to the point where we have those dollars, maybe we will, but we're trying to spend the dollars we have and focus on some of the lower paid employees or programs that we know benefit the lower paid employees and see if we have to like trickle up at some point. But we do have our eyes on that, and we are collecting the data so we can operate from a point of knowledge where those dollars would most benefit. And so you see the tuition reimbursement program dollars go up because we do know who's using that and who benefits from it and the number of people using it. So probably for all the programs we talked about today, we do know if it's supporting people of color or not, or lower paid, or we even have the gender statistics on it. So we're happy to share any of that. But I think we are focused on getting those dollars to the places where perhaps they would be better utilized or best utilized at this point.
Great, thank you. That's really helpful. I think data was a key piece of the email that we saw. So it's great to hear. And there are in this presentation, as really with every department, that you can see the hallmarks of the equity resolution being operationalized. So Mr. Stevenson has popped up, and so I assume you wanted to add something.
Well, I was going to affirm what Ms. Bird and Ms. Foster said. There's going to be a lot of concurrent activities going on over the next year, 2, 3 years. I mean, we talk about, there's a lot of data collection that needs to happen. We haven't been collecting certain data to know if we have an equity-based budget, so that and all the training going on. Ms. Bird and DMF met last week, I believe, talking about this exact issue. We're going to have continued conversations with the internal equity group. There's a subgroup related to budgeting that involves both county staff, of which I'm included, and school staff. So we'll be sharing ideas. So it's going to be a journey, I think, as it relates both to the operating and capital budgets.
Great, thank you. That was a weedy start to a question. I will yield to colleagues, but I really appreciate the background And you know, I think that from an equity resolution to the data that you need to the metrics without being so mired in metrics that it's not beneficial, there's a process, and we'll find that balance. I think it was Ms. Crystal first, if I have it right in terms of order. Thanks.
Thank you, Mr. Chair, and appreciate the opportunity. I think I'm piggybacking a little bit on one of your questions. I have two. The first is to follow up on Ms. Connolly's presentation from the Human Rights Commission, and thank you for the updates on some non-budget work, which this is often the only time our commissions get to present to the whole board. And so doing that within one's allotted 5 minutes is excellent and really helpful for us. But the piece about the affirmative action plan, and this has been something I've learned a lot from our human rights director of human rights, as well as from the commission, about how that works, and that we actually aim to have an affirmative action plan that is forward looking, right? So it would be adopted within 100 days or so of the new budget to guide the efforts for the budget ahead. My understanding is, after many years of being pretty late, we got a little closer to that ideal schedule in fiscal 21. So I'm interested to know what our timing is to have that for fiscal 22 to guide us, as well as whether it's the affirmative action plan or the barrier analysis. I know we brought in, I think ICF was our vendor to do that. In short, I just want to make sure, without getting too into the process weeds about sort of how those contracts are unfolding, if there's a role for the budget in appropriating more money to extend those contracts, that we're aware of it now, so that we can continue to get that outside expertise together, both the data to guide us about how affirmative action efforts are going within the county, and also continue to see that barrier analysis, which guides us to where, you know, the challenges may be throughout the organization.
I think, is it Miss?
That may be a question that for a written follow-up, if that's all right.
Sure.
Yeah,
I see Mr.
Chair,
Manager.
I was going to ask if you can tell I'm operating from my phone because my PC took a vacation. If Ms. Cowan is on, because we do have additional dollars and authority available, but she'll be able to speak to it more directly.
Okay, that's great. And I don't mean to put anybody on the spot.
No.
Knowing that there are sufficient dollars is really enough for my interest today, and then maybe just some written follow-up and update from the Office of Human Rights could be great too.
Yeah,
Sure.
Michelle?
Sure, yeah, can everyone hear me? Because I'm having same sort of weird.
We can.
Great. So in terms of the affirmative action plan, yes, you're correct. We did bring in outside consulting assistance for the first time to make sure that we could look at the overall process, our data flows, working closely with HR to get a more uniform kind of process in place. And we did just finish the 2020 affirmative action plan, and we'll be have contract and budget authority in place for 21 as well. And as Ms. Connolly noted, we're catching up on 2019. So I don't believe that is a funding request. And I think now that we've gotten this template in place, and I believe the consultant is coming to talk to the Human Rights Commission about it in April. They saw a draft of it earlier. I think we're headed in. I'm not concerned about budget authority or contract authority at this point. In terms of the barrier analysis, yes, the barrier analysis plan was completed, but not the implementation plan. And so a combination of HR, human rights, and then we'll be bringing in departments to talk through what that's a longer term, as everyone has talked about, a longer term strategy. So I don't know that there's initially anything needed more in funding for 22. Although I think as we continue to have that conversation with Marcy and her staff, we may come back to you and say, well, we'd like more training in this area after talking to ELT. As you know, though, in these cases, you know, part of the reasons why that the manager has a contingent is that we're able to move quickly too. So if we think there's $20,000 that we, like Marcy says, well, gosh, in the disabilities area, this is a great opportunity that I can jump on. She can come to the manager and quickly move to implement that when different kind of, you know, opportunities come up. But, you know, more to come. I don't want to say that long term we might not come back to you with ideas for 23 or 24. Marcy, I don't know if you have anything to add on that, but please go ahead.
No, and some of the work was underway because we knew some of the things we needed to do in recruitment. Once we come out of this COVID world, I'm assuming we eventually will, we might have some opportunities to do some more face-to-face job fairs because they're much more impactful than the online ones are. So there's costs associated with those, but historically, we've been able to absorb them in my budget. But if we were to increase those in great numbers, we might ask for more. But
okay. Thank you both. I find that really helpful. My other question is about options to allocate more one-time money for allocation or to compensation. And I really, Ms. Anderson's comments about the Civil Service Commission, I think probably resonate with all of us, that what we'd really prefer to do would be to do salary increases this year, because certainly our employees have been working harder than ever. A second year of freezes is not good for morale or retaining the best talent. The challenge is that we are pretty limited, as has been well detailed elsewhere in revenue pictures, on ongoing money. And speaking at least for myself, continue to feel pretty uncomfortable baking a structural gap into our budget by funding something as definitionally ongoing as salary increases and paying for it with one-time money. But we can use one-time money on bonuses, as Ms. Foster detailed us. And so I guess here's what my question to put a finer point on it is, do the costs, what are the overall cost of the one-time bonuses of $500 net? And do those costs increase roughly linearly? So, you know, if we were to say, well, we'd like to get to a $1,000 bonus, is that just roughly 2 times the cost? Would a $5,000 bonus be 10 times the cost? You know, is there any insight you can shed to us on the costs of and tools to kind of adjust up the bonuses with one-time money?
So you are correct. And I told the manager that we would have this information for him, kind of a chart of like options. So you can almost pick and choose, because there are some low cost things that you might be able to do with ongoing money. I talked about moving the ranges. If you move the ranges and don't give increases, it's still helpful because people know the option to get more money next year would exist. Now, if you moved them, you might have to bring some people up at the bottom who fall below the bottom of the range. That's a good thing. That's like giving the living wage an increase. It brings up people from the bottom, and the people who are lower paid will get a boost. So to move the range is not very costly. In public safety, it causes a little compression because they do start at step 1. And so you could have multiple classes, if you will, all at the same pay. So it causes a little bit of problem. With the general employees, less of a problem. The bonus is pretty linear. So if we give you a price for the $500 net, you can nearly double that to get your $1,000 net. We might ask you to focus on gross, because when you offer a bonus, you have to go back and allocate overtime to it. So overtime that occurred during the year. When you do it net, everybody's tax withholding is a little bit different. It makes it a little hard to manage. But if you looked at a gross bonus, but we give you the numbers for net or gross, but you could pretty much double them. They're pretty linear like that. But we would have a chart of information that you can pick and choose from. And the other ones, an MPA, the old COLA, an MPA, or a merit increase are pretty much ongoing dollars. Yeah, you could decide if you had some ongoing dollars and stay low, like say a 1% COLA or 1% MPA, and add a bonus on top of it if you wanted. Okay. So, but we would have that in a pretty easy chart to look at.
Excellent. And that chart is in the works.
I have that chart in my office. The manager doesn't have it yet. We're trying to figure out the easiest way to, look down and across and add column 1 with column B.
Get too into the chain of command and mess that up. But thank you. That is precisely what I'm looking for. And I'm delighted to hear that it exists, and look forward to consulting it and working with my colleagues on this, because I do think this is a shared priority. Appreciate it.
Thank you, Ms. Crystal. So there were some equity related questions. We kind of slid into other areas. I'll go with Mr. Dorsey next. I miss Ms. Garvey and Mr. Carantonis sort of punted. So Mr. Dorsey, if you want to go ahead.
Sure. Thank you, Mr. Chair. Appreciate it. A few questions. I'll try to make them quick. Ms. Foster, first of all, when you did your comparison analysis to our neighboring jurisdictions in terms of what they're looking at doing with compensation, were you able to ascertain whether or not they follow the same policy that we did here locally, not to have any reductions in force during COVID?
I cannot guarantee that they had no reductions in force, but in my conversations with them, they did not have reductions in force.
Generally the approach. Okay, thank you. Secondly, when it comes to sort of the bread and butter of human resources, acquiring talent To what extent do you utilize technology, for screening resumes and developing applicant pools? Are we still, or have we ever used, many of the variety of services out there that look for keywords to determine who makes initial cuts?
So recruiting probably is the most important thing you do. If you do it right, you don't have many problems along the way. So it's the $1 million question when you hire somebody, because you want them to stay for a number of years. So we do have technology. That technology can screen on keywords. We can also build some questions and analysis into that screening tool. So the capability is there. How frequently we use it, I would have to maybe punt that to Tamara if she even knows, or we could get that back to you. But the capability exists and we do use it. I don't think we use it across the board on every announcement we have. We do post them widely, so they go to a lot of organizations. And then the Washington Post and a couple of the other organizations cull a lot of that information for us. So we can get you the information on how often we use the capability, but it does exist in the software we have. The problem with the software we have is it doesn't move over to the payroll system upon hire, and it causes a different problem with the affirmative action plan analysis, because they're two distinct systems, but the capability is there.
Well, thank you. And at some point, I would just encourage a thought exercise about how to look at any of those tools as ways that bias can pervade. So,
right. So even that,
are...
I told you, we have to actually manually redact names and universities. I'm hoping that vendor will make that an automated process one day, so we can do it more widespread than a manual process. But yep.
Yeah. So thank you. And if I could just throw in a quick one, this is building on Ms. Connolly's conversation. So when it comes to, bullying, sexual harassment, do we have ongoing training that is available and required for people of certain job classes?
So required of certain job classes. I do not think it's required unless Anita tells me it's required in human services or parks, but we do have the training available. We can make it a requirement, like we have some required ethics training and some required diversity and inclusion training, and we can actually take some of the training we have and customize it for this organization. But it's available. I just don't think it's required. And Anita, do you want to correct me if you're listening?
So at some point, I'll just put in a plug to maybe encourage our really thinking about required training for people in supervisory capacities on key issues that can very much affect.
Right. So when we start looking at the barrier analysis and some of the outcomes there, we clearly need to upscale our manager training or our new supervisory training. So if we could capture everybody when they come on board or when they get promoted into a supervisory, rather than make it optional, make it more mandatory, that might be where the resource dollars are becoming an ask, because we don't have that capability or capacity right now. But if we could capture those new managers or new supervisors and kind of keep them in a room in a cohort type environment, we can get some great training done for them.
Well, I'd applaud.
And so that is work in progress.
All right, I'll look forward for updates. Thank you.
Thank you, Mr. Dorsey. Ms. Garvey.
Thank you, Mr. DiFranti. I think I ask a version of this question almost every year. Ms. Foster, could you talk a little bit about exit interviews? Because it seems to me all these things we're getting at, like barriers, frustrations, is it retirement pay? Is it pay? Is it benefit? What is it that motivates people to come, stay, or to leave? So I'd just be interested in what you do, and then how we collect. Do we have some, summary data of the kind of information you get back?
So we did have some data in the presentation. It was a little bit dated. I don't think we got great data during COVID, and we probably had far fewer people leaving the organization, so we probably didn't have meaningful numbers. So employees can always do an exit interview online. We use our Gartner contract, our corporate executive board contract, to do that exit interview. If people request an in-person face-to-face exit interview, we will make that happen for them as well. So there's a combination of online and face-to-face. Like anything else, the number of takers is probably low. You're probably looking at the 10 to 15% range of people who want to take that opportunity. So, but we do have that information. About a year ago, we kind of flipped it and we decided we wanted to do stay interviews. I want to know why you're staying. What keeps you here? Who are our top performers, and what makes this place hum and sing for them, and can we replicate that for the rest of the organization? So it's a different look. I mean, once you've decided to go, I might only get the disgruntled willing to take that online survey or do a face-to-face. Some people just leave because they're moving across the country or there's a better opportunity. But if you talk to people about what keeps them here, you can better shape your benefit programs or your training programs. So we have that data as well. And we'll have to figure out if we can continue to collect that and who the departments would ID as their top performers, the people they're really focused on keeping, and what makes this place the place they want to spend the rest of their career or the next 5 years or whatever. So that's just a different look at maybe getting to the same thing.
Thank you. I like the idea of a stay interview. That's great. At some point, and maybe with those that are leaving, if they're offered the online or you do, it's sort of passive. You might maybe you do sometimes reach out to make them feel welcome to come in and talk, or that you sort of actively want them to, because I think both sides of the coin are really good to have. And at some point, I would really be interested in kind of what you're learning from these interviews, because then that really would inform some of these decisions that we make here. I know, when I was on the school side, looking at why teachers stayed in, salary was not for teachers, not the top issue for them. And it was really, you might sometimes think it's all about the money. It's not. It's about a lot of other things, as I'm sure you know.
We could get you some information. What is rising to the top is more leave or more job flexibility. So a younger workforce has a different. Everybody wants to be paid fairly, but leave becomes really important now. So we can get you some information.
Thank you. And that may inform how much we keep things going virtually afterwards. So for people. So no, I'd really be interested in that. And then a slightly different question, different topic, my last one. And that's on healthcare. Do we have metrics? So there's a metrics about what things cost. Do we have any metrics that we're collecting on actually the quality of the service? I continue to think, and I could be wrong because this is just my own gut feeling, that a system like Kaiser, where their incentive is to take care of you and make sure you're not in the hospital too long and whatever, that you might have better outcomes than a system that actually just likes to have things charged over and over again. And they maybe don't follow so much the outcome for a person because you're going from doctor to doctor to doctor in a hospital and it's all kind of separate. So I've always kind of thought that perhaps a system like Kaiser's, something with that where the incentives are kind of aligned with the employees or the patients or their clients might actually have better outcomes. So I don't know if there are those kind of metrics.
So there are some national metrics and agencies that rank the providers, like the Cigna plans versus the United Healthcare plans versus Kaiser. So we have access to that. We have some metrics built into our contracts, like how often do they drop calls, the administrative type metrics. I don't know if I've ever seen anything as you're explaining it, does Kaiser get better outcomes? But we could see what we can find.
Yeah, if there's something, there must be something out there, because your metrics are really tricky. I find this, the data, we're all talking about data and what is it you're measuring and what is it you're looking at. And for healthcare, probably outcomes is a pretty important metric, but then those are harder to track. So I've given you two things that I'm kind of wondering about and interesting about that you might not have right away, but would be interested in that. Thank you.
Okay.
Yeah.
Thank you, Ms. Garvey and Ms. Foster. Mr. Karantonis.
Thank you, Mr. Chair. Following a little bit, going back to the issue of that Ms. Crystal took on with the bonus versus actually building it into the salary and creating a higher base to start while I hear Ms. Crystal to link this always significant additional expenditure with the availability of only one-time funding. There is also an alternative way to see that. One can see that also through a different lens and say, well, maybe we cannot afford so much, but therefore we are building it in as a salary increase, and then it will be a smoother curve to grow later. Because I connect adjustments in salary and compensation not only with, rewarding very good work. I mean, this workforce has performed amazingly over this entire year, but also with expectation of even higher productivity, higher dedications, and better service. So I saw that in Alexandria they actually went and they split the approach to salary increases in lower salaries and higher salaries. Then they applied a different percentage to each. Is that something that we've thought of, or is it something we shouldn't be thinking of, or what are the conditions to approach that thinking?
Alexandria has a pay plan that we used to have. So we abandoned that. And what they do is when they bring you on board and you're in one of the earlier steps in the pay plan, so you're in step maybe 1 through 7, they give you that 5% bump if you're performing adequately, because they want to bring you up to speed quickly and they think they're giving you a lot of growth opportunities. And the longer you stay with the organization, that increase drops. So somebody in years 7 to 10 or 7 to 12, they're going to get a 3.2% increase, and somebody in steps above step 12 are going to get the 2.3. But you're then rewarding your longest tenured employees who might be your top performers, who might now have the knowledge base that you really want to keep so you don't have to start over and recruit, less than you're rewarding the people that are just coming on board and learning the organization and learning their job. So we left that and went to a level 1 and said, as long as you're performing adequately, we take the same dollars we spent there and reallocate them and spread them. So we spread them across the board, so everybody's getting a 3.25. New performers, new hires are rewarded as much as people who have been here 10 or 12 years who are really effective at this point in time. But what we did when we went to open pay ranges is we said we don't have to fix on 3.25. You can pick 2, you can pick 1.5, you can pick 1.75. Alexandria's is fixed. They don't have the flexibility in their system to do anything than the 5, the 3.2, and then the 2.3 at the more tenured levels. So we built in the flexibility based on any budgeting issues you might have. So you can offer a 1% across the board. The ability exists. Alexandria doesn't have that ability in their program. They have to stick with the steps that they have set out there. So if we went there, we'd be going back to where we were probably 5 years ago. We'd lose a little bit of flexibility. So you'd have no steps or the steps they have. That's what we did a couple of years ago. Once or twice we had no steps because we had no flexibility. The current pay plan gives you some flexibility. So when I said to Ms. Crystal, you could do a 1% across the board and put a $500 bonus on there. If you think that really rewards the lower paid, you could do something like that. Some with one-time money, some with ongoing money, if you felt like you had that available to you. Does that help?
Yes, I understand it better. That helps. Okay. The chart that you're preparing, what options will it include? It will include the proposed 500 net bonus, 850 gross, or some variation of that, I guess.
We can run a lot of scenarios. I was trying to figure out the simplest way to present it. So we would show like a bonus or 2, because you'll see that it nearly doubles. If you go from a 500 net to 1,000 net, it doubles. We could show you a 1% MPA or a 2% MPA, which is a COLA. It moves the ranges and gives the employees that pay increase as well. And then we can show you the merit increase. And then we can show you how you can add together if you want to get there. And you can do things at mid-year. You can do COLAs at mid-year. You can't do your merit increases at mid-year. And you do something at mid-year, either cut your costs in half or you could double it if you have the same dollar amount. So we were trying to make a chart that's simple to follow so you could see what each item might cost and how you can stack them or add them together should you want to. So there'll be a multiple. And again, if there was something that came up that wasn't on that chart, it's easy enough for us to get that for you.
And federal money through the American Rescue Act, etc., would be directly useful or usable for that, or would have to shuffle and shift so that we make some of our contingency funding eligible and then replenish that through American Rescue Act money?
I think that's
The manager is going to tell you it's the great unknown. He's here.
Okay.
Yeah.
If it's unknown, it's okay. We'll discuss it when it becomes known.
Well, this is the challenge we have, which is that the legislation, the American Rescue Act, when it was in the House, it was very expansive about how we could use those funds. When it went to the Senate, through a series of compromises, it was really limited in the way it could be used. That answer is it's completely unclear. So it is my preference to get some guidance on that before I make any commitments out of that pot of money. It's very possible the Treasury Department will not issue that guidance in time for you to adopt a budget. So that presents another scenario, which we've done infrequently in the past, where we make some tentative decisions, but have to come back and have them confirmed. But, if you're into making, mixing and matching choices and considering an almost infinite variety of options, this is your year.
Thank you, Mr. Schwartz.
Just last word. I'm not going to take more time. I was frankly, since this is my first budget, I was surprised to hear that we don't have an anti-bullying policy, and that one needs to be adopted. So, are we working on this?
The anti-bullying policy's been in the works. We have a workplace violence policy, so we do have something. But yeah, they are both being worked on, I think, through a combination of human rights and human resources in the county attorney's office. So I don't have a time frame on it, but I know it's underway.
Okay, I would like to keep an eye on this. I'm really sensitive on the matter. Thank you.
Thank you, Mr. Karantonis. I think all of us will be interested in the chart and would love to know, I'm sure all of us would love to know the answers to Mr. Schwartz's thoughts about Treasury before we may know it. But I appreciate, Ms. Foster, your help with that, and we'll have additional dialogue over the coming weeks, I know, but we'll look for the chart through you and the manager. But thank you for the time presentation, and thanks to also Ms. Connolly for the presentation as well. Appreciate it very much. We will go on now to, I think it's back to Mr. Schwartz. We're about to head into the capital program, and colleagues may all know this, but I didn't get through all 90 slides. There are 90 slides coming up on this, so we will try to keep that in mind so everybody gets to their questions, but maybe also the possibility for responses afterwards in writing would be great. So over to Mr. Schwartz as we head on with our capital budget, and to reiterate, thank you, Ms. Foster, for your.
Thank you all. I'll become a spectator now.
Thank you, though.
Yeah, Mr. Chair, I also wanted to thank Helen Connolly because she's probably really sick and tired of the digit 7999 because her husband Kevin is running that operation for us. And so, Helen, thank you so much for bearing with us.
That is a huge, not easy job. And based on how much each of us on the board may talk to our spouses about the meetings, you are on call for 7999, I assume, based on that work. So big thank you. Sorry, go ahead.
Thank you. I'm going to turn it over. I think we're going to start out with our capital presentation. You know, we have so many presenters. I don't know who's going first, but we do have 90 slides, and I'm going to suggest that we pause at various points so that we can all catch our breath. And the slides will go somewhat quickly, but there's a lot of material packed in there. So I'm going to turn it over to Mr. May, I think, who is going to start off with an overview. Is that you, George, or we're going to?
No, it's Karen Talley.
Karen Talley. Karen, how are you?
I am well, thank you.
Go for it.
Good afternoon. So my name is Karen Talley. I'm the capital coordinator for DMF. I'll be presenting the summary program for the capital program, and I will then be followed by each of the departments who'll be presenting their programs. So Ms. Billman, could you bring up the slides, please?
We can see them now.
Okay, next slide. And the next slide after that, please. Thank you. Okay, so the fiscal 22 capital program budget covers a large portfolio of infrastructure investments. From our roads to our parks, technology, and government facilities, the FY22 capital spending totals over $100 million. These investments are made from a variety of revenue sources and often span multiple years. As we go through this presentation, we'll highlight the priorities, how we incorporated equity into our planning, and the impacts of COVID. Next slide. So I won't speak to all of the information here, but the main takeaway is that the capital program is working to overlay an equitable lens in the development of the program. From looking at where parks and facilities and other capital assets are located within our community, to making sure diverse voices are included in the planning process of our projects, we're working to include equity in how we build our projects. Some specific examples include how we use technology infrastructure to reach all of the populations with the installation of permanent and pop-up hotspots for Wi-Fi connections, as well as the upgrade to the Arlington Public School internet connectivity. In addition, public safety has systems in place that allow the community to voluntarily provide information about family, medical, or other special needs to improve public safety response. The goal is to ensure that all communities have equitable access and resources that will lead to a more thriving community. The proposed fiscal 22 capital budget builds on the one-year CIP that was adopted last summer. The budget is a snapshot of an ongoing capital program that has previous CIP projects that are already underway, along with the proposed projects that will be presented to you today. Examples of some of the projects underway include the construction of Fire Station 8, Jenny Dean Park, PC Systems, and the Treasurer's Enterprise Payment Portal upgrade. With constrained funding this year, we've continued to focus on maintaining what we have, with a limited number of new projects included for fiscal year 22. In addition, the focus of funding goes back to our goal of maintaining our capital assets in a state of good repair. Throughout this presentation, we'll be presenting a comprehensive look at all funding sources. But because this is the capital program of the annual operating budget, we will focus on pay-as-you-go projects. This slide illustrates the various funding sources that feed into the capital program. Capital funding has certain sources that are dedicated and restricted to specific capital activities. I'll begin with PAYGO funding. Our pay-as-you-go capital program is funded with both ongoing and one-time funding and allows us to maintain what we have and address unanticipated projects that are identified outside of the larger CIP planning process. This year's PAYGO budget is funded from local taxes, reallocated balances, as well as legally restricted bond premium funds. Other sources under the dedicated and restricted category are the Transportation and Metro funds, the Crystal City TIF, Transportation Capital Fund, and our state, federal, and regional grant funds are all restricted in use and dedicated for transportation and/or metro activities. These three sources together represent 72% of the overall capital funding portfolio. The final two funding sources are short-term finance and general obligation bonds. Short-term finance is 10% of the overall annual capital program budget and typically funds our core technology assets. GEO bonds in this budget represent previously approved bonds. The larger GEO bond discussion about new bonds will be in the upcoming CIP process. Next slide, please. As mentioned in the previous slide, PAYGO is proposed to be funded at $13.3 million from a variety of sources, including local taxes, reallocated balances, and legally restricted bond premium. It funds the replacement of assets with a useful life of 10 years or less, mostly projects that are not appropriate for long-term financing. PAYGO has traditionally been used to fund the routine maintenance of our capital assets. It serves to reduce the failure of our infrastructure by investing with the goal of maintaining our large portfolio of assets in a state of good repair. This year, there's been a greater focus on funding must-have projects due to the financial impact of COVID. It funds the replacement of assets at the end of their useful life, as well as those with the risk of near-term failure. Next slide. COVID has changed many aspects of our planning and budgeting. Changing needs of our community due to COVID are being addressed with PAYGO funding, which includes improvements to some of our outside community spaces and investments to support a variety of technology needs. In keeping with our sound financial policies, PAYGO plays a role as a flexible cash source. When it comes to the bond rating agencies, they expect PAYGO dollars to play hand in hand with our finance dollars. And finally, PAYGO can come from developer contributions that are made available as site plans progress through their process. Familiar and current examples of that include the Mosaic Park and Fire Station 10 in the Roslyn area. This slide illustrates the various funding sources for PAYGO across the past 5 years. It's important to have a combination of both ongoing and one-time PAYGO dollars to best manage the various funding needs of the program. As you can see, the ongoing funding across the last 2 years has been decreased as a result of the financial impact of COVID. The long-term goal will be to increase ongoing funding once the economic horizon has improved. Creating a more stable fund source with ongoing PAYGO dollars will allow programs the ability to develop a sustainable and predictable maintenance capital investment program. General obligation bonds are long-term debt financing for both county and schools' capital infrastructure projects. They fund county projects such as Jenny Dean Park, Fire Station 8, capital maintenance projects, and the repaving of our roads. Every 2 years, as part of the typical CIP process, the board approves a referenda that includes 2 years of GO bond funding. That referenda must then be approved by voters in November. Our 1-year adopted CIP this past summer presented us with a different scenario where we only had a 1-year referenda for fiscal year 22. As a result, the GO bonds included for the fiscal year 22 budget only include previously approved bonds. New GO bond financing for fiscal year 22 and beyond will be part of the upcoming CIP process. The $5 million included for GO bonds is from previously approved bonds from prior CIPs. The capital program implements projects across several years, and this demonstrates an example of that with the issuance of GO bond funds across several years as the project is being executed. Bond dollars are used to finance projects with an average useful life of 10 years or more and adhere to approved financial policies. Short-term debt financing is the financing of assets with a useful life of 3 to 10 years. Because of the shorter useful life of the projects, the interest rates are typically lower than the rates for long-term bonds. So, similar to a car loan, this finance tool allows us to spread payments over a term rather than paying all at once. This, of course, helps with the affordability of all of the equipment that is purchased with this source. As with GO bonds, debt service for short-term financing is funded in the general fund in the operating budget. This source has historically been used to finance equipment for enterprise technology and public safety. However, other types of assets like fitness equipment and synthetic turf fields with useful lives of greater than 3 years are also financed through short-term financing. With that, I'm happy to answer any questions, or we can move to the first part of our capital program presentation.
Thank you, Ms. Talley. Colleagues, I do not know if we have questions. I think I'm seeing a thumbs up. The next will be on facilities, and why don't we take your suggestion and go forward? I've written down a couple of questions that can fit into the next bucket. So go ahead. I don't know if that is you, Ms. Talley, or if that's Mr. May who's coming up next, or whether Mr. Schwartz through his phone or can direct us.
We're going to go over to Mr. May.
Okay. Mr. May, thank you, Ms. Talley, and stay close. We may have questions. Really appreciate it.
Okay. Good afternoon. I'm George May, DES Deputy Director for Facilities and Engineering. Today, we'll summarize our recently completed and ongoing project work in our FY22 PAYGO requests. Next slide. This slide shows some examples of the critical COVID protective measures we implemented since last March. As you can see, primarily signage and protective plexiglass shielding. Ensuring our buildings could be safely used during this pandemic was our first priority, and in some cases, this took precedence over our traditional capital projects. Looking forward to fiscal 22, our priorities are first, continuing to maintain our facilities with the safety measures needed to protect visitors and staff, and planning how we'll use our spaces when we return to our offices for post-COVID work. Secondly, as service needs change and evolve, we will continue to repurpose and adapt our existing facilities to meet our user group needs. And third, we will be focusing on critical facilities operations and continually adjusting our facilities capital maintenance program as required while working within our allocated budget. Next, please. This sample of completed projects illustrates some of our primarily HVAC infrastructure replacement work and highlights an additional maintenance responsibility we in facilities acquired with completion of the Lubber Run Community Center last summer. It also shows delivery of the first steps in the JBG-funded Bosman interior improvements. Next. Work underway includes projects funded by PAYGO, bond, and developer contributions, sometimes in combination. The PAYGO work that's underway includes projects like the boiler and generator replacement shown on the bottom row, and larger projects like Fire Station 8 that Karen mentioned, and the community group home at 1212 South Irving Street. Those are funded by bonds, and we'll discuss that more in our upcoming CIP presentations. Next. Our assets in the facilities world are the 87 county-owned buildings we operate, distributed across 9 county departments. 33 of these facilities operate 24/7. Our facility types, as shown on this slide, range from offices to fire stations to libraries to a multiple collection of buildings that support public safety, public health, and public works. Having some vacant space turned out to be a good thing. We were able to repurpose some of our available facilities to accommodate the emerging needs that came from the pandemic. We also support lease facilities, sometimes with PAYGO, but not as part of today's budget request. Rami Natour for Facilities Management and Michelle Condon for Facilities Design and Construction will present our fiscal 22 PAYGO budget requests.
Good afternoon. I'm Rami Natour.
Go ahead.
Good afternoon. I'm Rami Natour for Facility Management Bureau. Can you go to the next slide, please? We continually assess our projects portfolio in the context of conditions and available resources. Given the budget challenges this year, we deferred less critical projects and used savings from completed projects, allowing us to proceed with more critical projects shown on the next slide. These requested critical maintenance projects will improve ventilation in the detention center clinic, eliminate spalling concrete that is causing safety issues at Courseway West Garage, replace end-of-life HVAC units at 2 fire stations, and address potential structural failure at the 24th Street North CSI site. Next, please. Looking ahead, FM will continue to use facility conditions assessments to help track and estimate the maintenance backlog and set priorities. Our next funding opportunity will address deferred maintenance, including HVAC and elevators shown here, and issues like rusting pipes that can cause leaks. Another dynamic is that we try to maintain facilities in a consistent, safe manner. And when the remaining life of a facility is in question, like the Hudson Street Fire Prevention Office or Coursewell West, it adds another layer of decision complexity. We are trying to allocate funding to address our most critical systems. Michelle's next.
Good afternoon. I'm Michelle Congdon, presenting for Facilities Design and Construction. Our proposed PAYGO request this year is focused on planning and just the basics. Next slide. We are requesting continued funding to study evolving facility scenarios of yet to be funded projects. This past year, we studied various fire station test fits that will inform our pending CIP requests. With this year's PAYGO request, we will study such items as adjusting office area square footage for the post-pandemic environment and how functions and facilities in the courthouse area may evolve under a revised JVG ground lease. In addition, we will be completing the final 5th year of project oversight for the developer-funded Fire Station 10. The ongoing ADA program is funded with existing balances, which I will speak to more on the next slide. We do face challenges in maintaining consistent quality in our interiors program that is highlighted even more when we make improvements with new chairs, stand-up desks, and conference rooms in the Bosman Government Center using JVG tenant improvement funds. We are re-examining our priorities for ADA improvements as the conditions from the 2006 DOJ consent decree have been satisfied. Future requests will be limited to building code requirements consisting of primarily restrooms. The listing of unfunded items includes staff overcrowding in the Courts Police Building, restroom signage, replacing furniture, and interior maintenance associated with aging and heavy use. Next slide.
Thank you, Michelle. When we look ahead to fiscal 22, we are prepared in facilities to continue repurposing our facilities and adjusting our facility staff priorities to respond to the emerging needs from the pandemic and the post-pandemic world. This picture, as an example, shows how we adapted the vacant upper floor of the 2020 building to accommodate additional homeless service center clients during extreme cold weather with the needed social distancing. Additionally, we believe expanded telework in the post-COVID environment will create both opportunities and challenges as we evaluate how we're using our office spaces. We will continue the balanced and careful approach we described with limited investment in facilities that have uncertain futures and adjust as decisions are made about those facilities. We will address some of our deferred maintenance issues again during the upcoming CIP process and of course in future year PAYGO requests. In the near term, however, a response to any requests for longer term facility planning initiatives will be constrained by our current budgets. This concludes the facilities portion of the presentation. Open to questions you may have now or later as you wish. Thank you.
Thank you, Mr. May. Thank you as well, Mr. Natour and Ms. Congdon. Colleagues, this may be an opportunity to see if we can do a round that covers. We've covered quite a bit of ground, and I will start us off, and certainly if folks have questions, I'm going to start us off just by asking these are actually linked to the beginning part of the presentations, so bear with me. I think these are maybe DMF, or if we can follow up on a couple of items, and one of them is Ms. Talley or DMF, or maybe Mr. Manager, the Metro funding that we were able to eventually secure in the budget. It'd be helpful to know in a follow-up, not for now, if that has been estimated in the initial proposed budget that the manager had. A second question that I'm not quite sure, it might come in, Ms. Talley, your part of the budget. It also might come later. I'll just say that I've been thinking about it is broadband related one-time resources to increase what we can do electronically. That was in one of the preceding slides. And so I'm now interested in, and maybe this is a capital related federal type issue, that could we, for our commissions and some of our Bosman built rooms, could we equip those rooms with better screens in hopes that we would be able to do more virtual work? Those are two questions that I'll just see if we can, no comments, I don't think, in the interest of time, unless, Mr. Manager, you think there's a pressing piece of that you'd want to address now. But I'm very much appreciate each of the presentations, and I open it to colleagues if you have specific questions of the four lead staff that have helped present now. I see Ms. Crystal open to other comments. I hope those two comments for written follow-up at some point can be captured either by DMF or one of the groups of folks we have here. Ms. Crystal, over to you.
Well, I will try to follow your good lead and not get too mired in extensive questions, since this will be the one budget session that we actually do in the 3 hours. But I really appreciate the presentation, and I think this is such a reminder of the fact that you have one of the teams that is really enterprise-wide. You serve nearly every department in some form or fashion. I just wanted to, if we could return to slide 23. This one jumped out at me in reviewing in advance too, this sort of deferred priorities as a result of funding being less in fiscal 21 and 22. Great, thank you. So yeah, I mean, these are things that I think as you all framed up are consistent with some of the goals about creating spaces that are friendly to folks who are operating in this world with disabilities or those who are gender non-binary, et cetera. Could we possibly get a now or later dollar amount associated with some of these deferred priorities with funding being reduced in fiscal 22 in the manager's proposed budget?
Well, yes, we can certainly provide that. We don't have all the numbers on the top of our head today.
No.
Yes, they're available to us, and
Okay.
We'll get them back to you.
Excellent. I mean, not to imply that we were just awash in one-time money, but we were talking, an hour ago about one-time priorities, which we have a little more running room as the otherwise erstwhile COVID contingent has been freed up. And so, certainly capital priorities that reflect our community's values may be one to target with that. So I'd be very interested in seeing it, and I appreciate the follow-up. That's it, Mr. Chair. Thank you.
Thank you, Ms. Crystal. Ms. Garvey.
Thank you, Mr. Chair. So I have a general question that I'll invite staff to talk about. It might be even for the manager, just a little bit. I think it's a discussion we can have at length and probably will. And that's the issue of what I picked up here is all of the uncertainty. We've got structures that are at the end of life, and we're trying to, do everything we can to kind of keep them going, but not put more into than is worth at this moment. And then we have this whole question of how are we going to be using our facilities, and we need to maybe adapt them and use them differently. So it seems to me there's some very large decisions to be made that could cost a lot, but we don't really have real good information quite yet about how we're going to make those decisions or where we're going to be. So I think my question is, do you have a sense of the timing for making those decisions and kind of a process as we kind of work it through? Because I'm imagining we may be taking a little, which I think we should, some out of the box looks at how we're going to use facilities and what we really need. Does that question make sense? Because it's kind of a big general one, and I didn't want a whole lot of time spent on it, but it seems like an important overall issue.
Yeah, well, welcome to what I call the field of anxiety, which is the inside of my brain when I'm trying to balance all these different things. Let me give you an example. And the example is our Court Square West facility, which for at least 15 years, people have said that building needs to be retired. As if you actually look at the courthouse sector plan, it is to be removed. And so there's no, as I've said to staff, there's no better time than right now to figure out whether we can do that. So when we do that, meanwhile, on a couple of the slides you saw, we need to make investments because we still have staff in that building. So it's really just a difficult balancing act. And so the first thing that we're going to try to work through, and I think George spent some time talking about this, is I just need to sit with each department, and we're going to do this over the next month or two, and to determine how they want to make use of their current space. And I don't think that you're going to see that departments are going to need to reduce their space, but they're going to need to use it very differently. And that will form a baseline, and then we'll move from there and see what, if anything, we might be able to do about consolidating space. And we just have a lot of things in motion. And I think I'll have a better sense of this when we get to the CIP, but even a better sense 2 years from now. So that's a sort of a non-answer, but you've hit upon the essential question that we're struggling with.
No, it's exactly the answer I wanted to hear, really, just how you're thinking about it. About that stress space in your head. Spend a little time with Dr. Cooper Lucas, who spoke earlier today, maybe every day, Mr. Manager. Don't let the stress get to you too much. But yeah, these are just big, complicated issues. And I appreciate knowing a little bit about how you're going to be working them through, and obviously helping us work it through later too. Thank you.
Thank you, Ms. Garvey. I don't see other hands.
Just for a second.
Go ahead, Mr. Karantonis.
Quick question. So this year I have just the impression that the water main issues and water main problems have been slightly less than an average in years past. Can this be true, or are we more or less where we were? So my question is, since we have less traffic on the roads, etc., whether we are allocating something for preventive, advanced maintenance work in critical infrastructure.
I think is it Mr. May or Mr. Schwartz? Or
you know what? I'm gonna let Greg give the answer. I know what the answer should be, so I'm sitting here listening very carefully.
I would say that, obviously from year to year, our amount of water breaks varies. It's often driven by the cold snaps that we have or don't have, and that temperature differential that occurs in the soil. And of course, the conditions of the pipes and other random stuff. Construction work and heavy traffic can also influence that, but mostly we see patterns associated with temperature cold snaps.
But in general, since we can work in our road work easier than if we have full traffic loads, is it worth thinking about doing some preventive maintenance or some preventive?
Yeah, we took ourselves up with that opportunity back last March already. You may have noticed we did things like on Clarendon, where there used to be old crosswalks that were a combination of concrete and bricks, like over the Whole Foods and stuff. And they were really difficult to get to and remove during heavy traffic. That's the type of thing we took care of last summer. We're trying to continue to do that type of thing with the next upcoming paving season, so that we hit those hard to maintain spots while the traffic volumes are down. So that work continues. Obviously, we couldn't do it through the winter, but as we're approaching our next paving season, we'll look at remaining opportunities.
Okay, so that's the plan. That's good to know. Thank you.
Thank you, Mr. Karantonis. I would also guess that you could follow up on that in the course of the CIP as well. So seeing no other hands, we will thank, in particular, one thing we don't get to do because we're not in person is at least look and really show you how our great thanks to those who spoke. Mr. May, your public service is absolutely clear, and we are grateful for it. Same with Mr. Natur and Ms. Congdon. We know there's a lot of people behind you too that are critical to making this county work, and that's the heart of what we try to do. So a big thank you to each of you, and we will move on. I think it's Mr. Beach next with Department of Parks and Recreation in our Capitol tour. So I do see Mr. Beach, and unless Mr. Schwartz comes over the top with a voice of God style comment, we'll go to Mr. Beach.
I'm not hearing the top of God style comments, so I will go ahead and get started. Good afternoon, everybody. I'm Eric Beach with I am the Park Development Division Chief for the Department of Parks and Recreation. Before I get started, I just want to mention that on the call today with us is our Director, Jane Rudolph, Acting Deputy Director, Rebecca Schmidt, Management and Budget Specialist, Brittany Canny, and our Capital Asset Manager, Robert Capper, who may assist with any details or questions that I just can't cover. So with that, if we can move to the next slide, please. During the pandemic, we have seen that our parks and trails have been busier than ever, and our work to maintain and improve our facilities has kept up with that. As our contractors continue to work, so have we. We've been able to adjust with new ways of doing business. For example, we're using online permitting, virtual inspections, and other tools that our colleagues in other departments have implemented in order for us to keep our work going. This allowed multiple projects like Longbridge Park Aquatics and Fitness Center and others to maintain progress or to be completed over the last year. Next slide, please. Several of the projects we have completed over the last year include Madison Manor, as you've seen on the right here. This was roughly a $2.7 million project. Saw the renovation of the playground, field, shelter, courts, and some stormwater improvements. Seen on the left is Benjamin Banneker. This was particularly gratifying. This is a project that was begun after the consolidation of multiple small parcels over many years. This assemblage of land allowed us to move the playground out of the RPA, away from the stream, and renovate the dog park, field, and parking lot. We were also able to combine the maintenance capital project funds with our trail program funds to improve the 4 Mile Run and WOD trail where they come together through the park. Next slide. Another project completed that we talked a fair amount last year was the Lubber Run pedestrian bridge that was replaced. Which replaced the original bridge that was damaged in one of our stormwater high water storm events. This is a good example of flexibility in the use of our capital funding, as we were able to move quickly using funds from our feasibility study program to complete the design work, and then paired it with funds from the bridge and trail program to complete the construction work. Next slide, please. We also made progress on maintaining safety on our synthetic fields. On the left, you can see the Gunston rectangular synthetic field, which 70% of the total cost was paid for out of our FY20 short-term finance funds, and 30% came through our partnership with Arlington Public Schools. On the right, you see an image of the Diamond Field at Barcroft Park, which 55% was paid for by our FY20 short-term finance funds, and 45% through our partnership with George Washington University. Next slide, please. Currently, we have 19 projects in various stages of progress. A few examples, and I won't go through all of these, of ongoing projects that include projects in our scoping stage, like the replacement of second bridge at Lubber Run and safety servicing at Tuckahoe Park. We are planning for a new park at the former Teardrop site in Crystal City, right near the new the Amazon development. In design, we have accessibility renovations that are underway for restrooms at Madison Manor and Fort Scott Parks. And permitting, we have Alcoa Heights, Marcy Road, and Towers Park. And in construction, we have Jenny Dean Park, two different parts of Roswell Highlands Park, that being the park itself and the playground located at the Appa Queens Court site, and Sitkala Saw Park. So we have a lot going on, and we're pretty excited about this year. Next slide, please. As Jane Rudolph mentioned during her presentation of the park's operating budget during the work session in 2 weeks ago, DPR, we have a wide and sizable inventory of parks and assets. One of the ideas I think is important when we look at this is that if you take numbers like 147 parks or 81 playgrounds and then add up all the pieces of equipment such as benches, drinking fountains, trash, recycling receptacles, etc., that make up each of those larger numbers, you're going to get a sense of how our asset inventory covers thousands of items. Next slide, please. With a goal to maintain our many assets at a high level of good repair, we utilize several tools to assist us. We are continuing to improve our asset management tool, which is an on-site assessment of all DPR's 159 parks and every item within it for its state of repair or remaining life cycle, where it sits in that life cycle. This will also integrate all that data into DPR's work order and asset management software, allowing us to do real-time maintenance and long-term planning. For synthetic fields, we assess their safety conditions using certain defined safety standards on an ongoing basis, typically here to an 8-year life cycle with these. And for the trails and bridges, we have recently completed assessments and have been continuing to work on our prioritization coming out of those assessments. Next slide, please. As we do every year, our goal is to maintain our park assets in a high quality state of good repair. For this year's request, we specifically focused on projects to keep up with on-cycle replacements or those that were already underway to keep those commitments and to keep the project moving forward. With that in mind, this year we're recommending 3.7 million in capital maintenance funds. Next slide. The projects that make up our capital maintenance request of 3.7 million are either assist us in managing our capital assets or on our previous projects we have begun with the community. These do not include our synthetic fields, which I'll talk about in a few slides. Of that 3.7 million, we are recommending 165,000 for our capital asset manager. This position manages our capital asset tool. It is instrumental in helping craft our capital program. We're recommending 125,000 for the Parks Field Fund. This fund is supported by the fees assessed on our affiliated youth and adult sports participants, and the budget reflects the fees projected to be collected in FY21. We're recommending 134,000 for our feasibility studies program. These are the funds I mentioned earlier that allow us to be nimble and address projects that rise outside of the yearly planned CIP schedule or capital maintenance schedule. And 200,000 is proposed to complete our asset inventory, and this would be the third and final year of this project and request that you would see. Next slide, please. We are recommending 1.282 million to begin and complete the design that's associated with the renovation of Bluemont Park tennis courts and its support area and facilities. We began public engagement on this project in 2019 and will continue this engagement through this design work. We are also recommending 1.685 million to complete the renovation of Alcova Heights Park. The community was engaged in design complete along with the design of phase 1 between 2018 and 2019. So this is coming back and finishing that work. It includes accessibility renovations of the restrooms, replacing the basketball court, and other improvements. Lastly, DPR is requesting $100,000 for community fitness center equipment, and this allows us to replace equipment that either breaks down or ages out in our facilities. Next slide, please. This year, DPR is requesting 1.53 million for the synthetic field program, and 489,000 of that is coming from existing balances. These are focused on keeping up with our on-cycle replacement of fields in our existing synthetic field inventory, which is 14 rectangular and 2 diamond fields, so a total of 16. Next slide, please. Comprising that $1.53 million request is 773,000 for the conversion of natural grass to synthetic grass on the upper field at the Thomas Jefferson Middle School, 268,000 replace a synthetic field at Rocky Run Park, and 480,000 replace a turf at the community field at Barcroft Park. Next slide. As we put together our request, we take certain things into consideration. We attempt to keep our focus on maintaining an adequate level of funding to achieve a state of good repair for our assets and the prudent selection of products that are in need of replacement. In order to make that wise investment, our request continues efforts improving our asset management and the tools needed to support the planning for replacement. And then we also try to leverage partnerships where we can bring in other resources to bear. We have cost sharing agreements with Arlington Public Schools, George Washington University, Marymount on our synthetic fields that are win-win for both of us. And other examples where we work with these partnerships are recently in the process of or have approved collaboration agreements with Roslyn Dogs and Amazon to bring temporary dog parks to Roslyn, Pentagon City in areas that were identified in the Public Spaces Master Plan as lacking in access and service. So with that, I want to thank you. This concludes my presentation, and I can take any questions you may have.
Thank you, Mr. Beach, for that quick but thorough overview. Don't know, colleagues, I don't see hands. I'm certainly open to questions. I know that we had some discussion in the operating when Ms. Rudolph presented about park maintenance, and there's capital maintenance that's touched on here. At least for my part, I might ask for a follow-up to see in that delta what projects that we might have wished that we could do we're no longer able to do. I think it's, that's, you presented what makes up that smaller sum, but it might be helpful to know what we had thought we might be able to do and aren't because of the COVID related budget. Is that question make sense to you? Mr. Beach?
Yes, it does. And what I might answer is that we can certainly come back with some more information. We do, the way we look at our assets, we're able to program our assets, and so we believe we are tackling sort of the most in need right now, and we can manage those in the next several years and be able to program that out. But if we can certainly provide more information about some of what we were thinking.
Great. Thank you. That's helpful. We'll see Ms. Garvey's hand go. Ms. Garvey.
Yeah, I just want to, I think I've been doing this a while, and I just want to say I was struck by this particular presentation, how far DPR has come since when I first came on the board. There were different folks there. There wasn't a whole lot of, I mean, just the whole structure analysis approach. It's strategic. It just feels very comfortable to me, and it wasn't that way before, I don't think. So a lot of really good work has been done over the years, and I want to thank our staff. I know they also I think do a pretty good job on community engagement, which is not so easy either. And just want to thank everybody.
Sure.
Thanks.
Well said. And we'll add, I know all of us on the board thank you and the team behind you that is identified, Ms. Rudolph, the acting deputy director, Ms. Schmidt, and Ms. Canny and Mr. Capper. And there's so many behind in the DPR. It's been a hard year for you and your team and the team in particular. So a big thank you. We may have additional questions that we may submit directly. For now, we'll end with a thank you and move on to neighborhood conservation. Thank you, Mr. Beach.
Great, thank you.
I think it's Mr. McIntosh.
Yes, it is. Good afternoon, members of the board. Nice to see you all again. While we're waiting for the presentation to come up, I will say that with me today also is our Neighborhood Services Division Chief, Chikwe Njoku, and our Budget Management Specialist, Steve McCall. Okay, with that, I'll get into it. Next slide, please. Okay, so this is a list of our project accomplishments. Over the past couple years, we've had a really robust construction season, both in 2019 and 2020. It's been, we've made a lot of good strides and have a lot of accomplishments. One you'll see here is the 7th Street South Trail Connector, which we did in the Barcroft neighborhood. This connects to the W&OD Trail. Next slide, please. Another one is a really critical sidewalk connection from Lee Highway to Glebe Road. It's the last section in this stretch that connects the pedestrian network. Turned out really well. Next slide, please. And this is Oakland Park, which was also upgraded and updated last year. And this is right in the Boston, Virginia Square area. So a really heavily trafficked and highly used park. Next slide, please. So this is how we keep track of our portfolio. And so there's a lot going on here. I just want to highlight a few things. The 3 categories are how we sort of track the life cycle of where an NC project is. What you'll notice in that last category of projects in construction, most of those are completed now. Most of them have been worked on this past year, or rather mostly in 2020. And the ones in the middle category I want to bring your attention to, I want to highlight some really good news that we've been working on, especially in collaboration with our engineering bureau. We have really been focusing on reducing the timelines for our projects and the throughput and the execution rate. This is evidenced with a couple of projects. You'll see the first 2 in the middle category, 4th Street South and 9th and Larimore, which you all as a board approved on consent this past Saturday. These projects were approved by the board in November of 2019. And here we are about 18 months later, and we're about to go to construction. The first project on the in construction phase down in the last category, 14th in Ohio, is another one that was approved by the county board in November of 2019. And I'm happy to report it is actually almost finished construction. So I think that's just really good news. And it shows how we've worked really hard to make sure that our projects move much more quickly, much more efficiently, and that we're resourced accordingly. So I just want to thank a lot of folks involved, especially engineering. We've worked hard to make sure these projects get moving a lot quicker and we get them to the neighborhood quicker. Next slide, please. So this was our, at the top you'll see in FY21, that was our adopted issued amount of bonds that we've been using for most of the construction projects that you've just seen. And the proposed $2 million will be used for our next batch of projects that we will be doing the rest of this year. Our pay-go amount for $500,000 is the same as it was last year and has been the same for many years now. Next slide, please. So some of the key budget considerations, at least from our end, I know that we continue to see really high demand for projects in residential neighborhoods, and I think it's going to be important for us to manage the expectations of those residents in those neighborhoods. They have a lot of projects, and we want to make sure they understand we can't do all of them at once. We know that. And to that end, we need to continue to focus on a mix of not just larger projects, but also smaller projects that can help make a difference as well. Next slide, please. That is it. That was the last slide. So happy to answer any questions as well. And thank you all. That concludes my presentation.
Thank you, Mr. McIntosh. It seems like just a few minutes ago we were working on the project that we had Tuesday night. Appreciate on project after project there are a lot of details to bring these NC projects forward. So we have a question from Ms. Crystal.
Yes, thank you.
Great, thank you so much, and thank you for the presentation. Seeing the park example made me realize, and please feel free to correct my premise here, but I feel like of the projects for which we've been awarding contracts, so the ones really finally getting to the conclusive level at the board level, I feel like I've seen many fewer or shift from those parks projects to largely the street safety improvement, curb and gutter, et cetera. I wonder if that's, first of all, if that impression is right. And if so, whether you foresee perhaps with adoption of the public spaces master plan or other kind of guiding documents to indicate where parks should be going and expanding and timetables for their renovation, whether you see neighborhood conservation sort of shifting more into the street improvement, safety improvement, curb and gutter, stormwater facilities, et cetera.
Yeah, no, thank you. Great question. No, we're still consistently approving park projects. They're probably about a quarter to a third of our portfolio. The last batch of projects, we did have a park project in there. Seems like every funding session, we have maybe 3 or 4 projects. At least one of them is a park project. And we still have a high demand for them. We still have several of them in our portfolio. When we do get park submissions, we're always working with our parks department, the park area managers, and the folks that design these projects to make sure that they're consistent with what they're looking at and making sure that we're incorporating the features that we should be, and also to leverage where there are opportunities for us to work together on different parks as well. So that relationship, I think, is going to continue, and I still see that continuing.
Thank you. It's helpful.
Sure. Thank you.
Great. Well, I'm glad you asked that. Your comment about Mr. McIntosh about managing the expectations as we move beyond COVID, I'll have a question for the manager about our long fiscal practice of being under the 10% on general obligation bonds. There may be a little more room there, but it will take time, and the impacts of COVID will go on even if we get vaccines out to everyone. So just really appreciate your continued work and leadership on the program. And I know each of the members of the board want to thank you as well for your time, in addition generally on the program, but also Tuesday night as we work through that item later in the evening. So with that, thank you. We'll go on to Human Services.
Thank you all as well.
Sure. And Anita Friedman. Ms. Friedman, I think we'll go directly to you. I believe that almost all of us were on the phone on the Teams meeting today, where you did the keynote for the Women's History Month celebration, our WOW group, employee group, and all of us were moved, and so we ought to take this moment to thank you. Without doing so too lengthy, but really to thank you, because it was extraordinary to learn and to listen. And so with that, we'll go to Ms. Friedman, you and I think this is Human Services broadly.
Yes, thank you very much for your comments. Thank you, board members. And I am actually going to turn it over to our Chief of Management and Budget, Mr. Corey Travis, who is here to discuss with you our short presentation about our information technology requests. Corey?
Hi, yes, good afternoon, everyone, and members of the board. Nicole, if you want to go to the next slide. So we'll get started with going over some of our current projects that are funded with CIP funds. So the first is our electronic health record, which is the Welligent system that you see on the left. Welligent is our electronic health record that is used by the Community Services Board, and it is the medical record in which our clinical staff record medical services that we use for insurance billing and tracking the outcomes of our clients enrolled in these programs. We had $175,000 allocated in FY16 to onboard a contractor to help us draft the RFP. And in FY17, we had $1.75 million to procure the system itself. The system is used by a little over 200 clinicians, and it is responsible for bringing in over $4 million in annual insurance reimbursement revenue. And we do anticipate the system to go live in the first quarter of FY22. And the second system that we have currently funded is Yardi, and Yardi is used by our public assistance and housing programs, and this does include Housing Choice Voucher, Section 8, and a few other programs that provide general relief assistance to clients. In FY19, we got $377,000 for both systems, and in FY21, the system was used to process over $30 million in annual subsidies to clients for rent and other types of public assistance. And we do anticipate the system to launch in the first quarter of FY22. Next slide, please. So our funding changes for FY22. So in FY21 revised, we did defer $500,000 in FY21 PAYGO for the child welfare system into FY22. And in 22, we are asking for $300,000 for the child welfare system and another $250,000 for the child care licensing system. And for the record, in 23, we will be asking for an additional $950,000 on the child welfare side and an additional $300,000 for the child care licensing system. And that concludes our request for FY22. If there are any questions, I'm happy to answer those.
Thank you, Mr. Travis. I don't know. We have a question. Ms. Garvey, go ahead.
Yeah, just a quick one. Could you talk a little bit, and maybe this isn't quite your bailiwick. We have so many different software systems and legacy systems, and we have a terrible time because they don't talk together, each other. I'm assuming these newer systems, we're finding ways to make sure everything kind of talks to each other as much as it can. I see Ms. Friedman kind of nodding her head.
Right. Well, I know in the department, we do have over 60 systems that are used by our various staff. Some of those systems are mandated by various state and federal programs, and other ones are completely managed and administered by our staff in DHS. These two systems, Welligent, our electronic health record, does not currently interface with other systems at this time. But while we're going through the development, we are working with the vendor and exploring other opportunities for interfaces so that clients can have a portal through which they can schedule appointments, speak with their clinicians, and exchange other pieces of information. And on the Yardi side of the house, there are interfaces between that system and the county's Oracle ERP so that we can facilitate the payment process. So we have weekly and monthly interfaces that generate those $30 million in payments that I mentioned earlier.
Okay, thank you. I know this is Ms. Friedman.
Yeah, Ms. Garvey, what you mentioned has been a concern for me for many years because we have so many different systems and clients' records are held in different systems and they're duplicated. We actually applied for a grant and obtained the grant from the Kresge Foundation, which is a 3-year grant, $100,000 each year, to conduct an assessment and do a service integration pilot where we would basically, we've been working with DTS, obtain an application, this one's called Novetta, to pull the information from various systems to be able to have an unduplicated view of the clients in terms of their demographics and the programs that they're enrolled in. So we're currently working on that.
That would be great. Yeah, no, thank you. No, I know I've heard for years about, the problems with the different systems and actually the burden it places on our clients. So anything we can do, it's a constant challenge, I think. Thank you.
Thank you, Ms. Garvey. Mr. Karantonis.
A very quick question, just for my for clarification. So Welligent will also cover and support our mental health response, right? Mental health services, right? Okay, there are more questions on that. They will come offline. Thank you.
Thank you, Mr. Carantonis. Ms. Crystal.
I'm sure Ms. Freeman knew I was going to ask about it as soon as you said it, Mr. Travis. What does the new childcare licensing system mean for clients, i.e. Centers looking to get licensed through Arlington County?
So you may know that we do not have a system right now. I think you probably remember that for our childcare licensing program. And so this would basically be creating an integrated system with real-time accessibility where the public and the families who are looking for childcare could obtain information in real time about availability of slots, costs, inspection records, where we would be able to basically put out information to the public and for them to use to search and understand where we are with each center and their own inspection and programs.
Oh, that's even better than I hoped. I thought this was like a Permit Arlington type system, but being able to enable that public search is going to be invaluable. Really excited. What would be the timeline if we start investing this fiscal year? Is it sort of a multi-year project to build it out? Could we see it within the next fiscal year or two?
You know, unfortunately, these system updates and enhancements always take longer than we projected. For example, Intelligent is now going on 5 years of implementation. So the childcare, we're looking at different options around the region also to see what other jurisdictions are using. So maybe it won't be as complicated, hopefully.
All right. Fingers crossed. Thank you. I'm really glad to hear this.
Thank you for the question, and Ms. Friedman for the comment. And we appreciate it. We will also be thinking there's many investments to make once we are more firmly in a managed post-COVID world. So we appreciate that presentation. So next we will go on to public safety, I believe, and it's Ms. Costanzo. And go ahead. We're here. We appreciate it. And public safety.
Good afternoon, everyone. My name is Amy Costanzo. I'm the budget analyst here at the police department, and I am joined by the other budget analysts from our public safety agencies, as well as our directors and chiefs. So next slide. So just a quick overview of all of the project accomplishments from this fiscal year thus far. First of all, as I'm sure everyone heard, we launched our body-worn camera program in January. We've also replaced our computer forensic servers within the police department. Our e-summons project is up and rolling. Our fire records management system is complete, as well as IP simulcast, live scan. Our public safety servers have been refreshed, including those that store information from our in-car cameras, and our WestNet fire station alerting system has been completed as well. Next. Projects underway. The replacement of our computer-aided dispatch 911 system is currently underway. Our fire command vehicle is getting a full technology refresh because the police department and the fire department are now sharing a command vehicle, and the technology was a little outdated, so that refresh is underway. And implementation of inmate telephone, tablet, and video visitation within the jail is also underway. Next. So just quickly, this is a snapshot of our asset inventory. Most of our assets have somewhere between a 5 and 10 year replacement cycle. On this slide, we have OEM and the fire department's assets. It's a good mix of technology, vehicles, and stuff. So you can see that a lot of them are coming up for refresh either next year or in the next couple of years. Some of the bigger ones, like the WestNet fire station alerting system, are not due for another 10 years because those were just implemented. But there's a quick snapshot of where we are with those two agencies. And then this is a snapshot of where we are with the sheriff's office and the police department. Again, anywhere from 5 to 10 years on a refresh cycle. A good mix of technology and things that are carried by people, and also some good security measures in there. So this is a look at what we're asking for in FY22. It's a big year in terms of short-term finance. We are asking for $3.5 million for the replacement of all of our mobile data computers that the police officers use. We are also asking for $4.3 million for the replacement of fire vehicles and $133,000 to continue our e-summons project. And then lastly, just a couple of key budget considerations that are similar to those we've had in the past years. All of these capital dollars fund our critical systems within all 4 of our agencies. A lot of this is not funded in our operational budget because the scope of the projects are so large, and also the length of time they complete is typically longer than 1 fiscal year. So we really rely on these capital dollars to get it done. We obviously have to keep our systems refreshed and up to date to maintain a state of good repair so we can serve our citizens well and keep them safe. And lastly, regional collaboration on these systems are going to require longer project timelines, larger scopes of work, but all of this leads to greater efficiency and more cooperation with the public safety agencies that surround us. And that is it. Happy to answer any questions.
Thank you, Ms. Costanzo. We will, let's see, colleagues, questions. I will, the computers and the fire vehicles, I'll want to follow up a little bit after on those with a question, but I see Ms. Garvey with a question.
Yeah, just quickly, I just want to confirm, I'm pretty sure I know the answer, but in case people are watching, so we, keep our equipment really up to date, but it isn't like we just throw away the old fire trucks, right? I believe they even get sold possibly to other jurisdictions that will buy them, so that it's not like a complete loss after a few years. Is that correct, Ms. Costanzo?
I'm going to punt this question to the fire department.
Okay.
Hi, Ms. Garvey. This is Casey with the fire department. Yes,
Hi.
We actually have a buyback program where we're guaranteed a certain amount of money for the buyback of the apparatus once we're done with them after the 8-year period.
That's great. Thank you. Yeah, because some people might just be watching this and think, oh my gosh, that's just, so thank you for that reassurance. Yeah.
You're welcome.
Great. Thank you for the question. I appreciate you making that clear for those watching, and appreciate the presentation from Ms. Bailey and Ms. Costanzo. We don't appear to have any other questions on the capital component of public safety at the moment. We may be following up with written questions. We will go ahead to the capital part of technology services. I believe it is your Mr. Richard, your last name approaches mine.
Sternitsky.
Sternitsky. Thank you. Go ahead.
Good afternoon. In the gallery, I have Jack Belcher, our CIO, John Bayless, our COO, and Gilbert Pisano, our newly minted management and finance manager. Next slide, please. Project accomplishments. We have a fully operational 3rd data center in Ashburn. I won't mention the site location in its totality, but we are fully operational there. That is a site that is equal to our Bosman Center and our Trade Center. We also have completed a substantial refresh of the core network equipment around all of our hub and core sites and our data centers, including a server refreshment and a data storage refreshment, including backup to the cloud for redundancy. We've done a number of digital equity projects, and for the last more than 12 months, COVID projects, which means dispersing into the employee base and volunteers' laptops, Wi-Fi, building infrastructure, and other pop-up projects as they occurred. Next slide. Currently underway, PC replacement, which is a rolling replacement of desktops and laptops. We are in a mobilization or laptop first posture. So employees get a laptop now when their system goes end of life. We've also dispersed a large amount of equipment into DHS and into the COVID teams. For Prism, which is Oracle EBS, we are completing a technical upgrade. That should complete, I believe, in about 6 to 8 weeks. That keeps us in compliance with Oracle for support of the product. We'll talk again about that later. Along with that is a new reporting tool called Splash BI, which should go online also in the next, I think, 6 to 8 week cycle. In terms of network refresh, phase 2 of the refresh is architecture and security enhancement. So given the opportunity with the new equipment, which has new capabilities, we are changing the way the network internals work, which will make us more secure, I'll just say laterally across our data centers. Moving to the network edge. This was funded in the last fiscal year, and we deferred most of the work. This is the equipment that goes to serve wired and wireless connections in our office complexes. With many of the staff being out and a movement towards work from home and telework, we decided to hold this back until we have a better understanding of what our return to work is going to look like for the entire organization and actually down to departments, agencies, and buildings. And we'll come back to that again later. Remote access technologies. This is a whole variety of technologies that are everything from user identification, certification, how they operate in a telework environment, and all of those are going through minor enhancements on a month-to-month basis, on a rolling basis. The enterprise payment portal work should complete here in the next couple of months, and that brings us up to date on ACE and EPP. And the county website replacement is underway with a delivery date of 4th quarter of calendar 21. Next slide, please. Breaking down our asset inventory in terms of hardware components, I won't bore you with this slide. We talked a little bit about the network edge. We are starting that project now with Courts Police, which does have a regular building occupancy that is unlikely to change going forward. So that'll be undertaken between now and June, and the rest of the buildings we will take a look at as back to work policy and the departments figure out what they're going to do. The only other thing of note here is our telephone system is 10 years old. As you all know, with extension 7999, we're fielding a lot of calls. So we're putting some pressure on this system, and DMF is holding some reserve for us should we need some quick money to go fix, repair, or upgrade that system. But it is time to start thinking about what that system will look like in the future and what telephone means to us in a digital age. Next slide, please. Software inventory. Today, everything is maintained in a good state of repair. We have some major projects that are just over the horizon. The next ACE for collections and probably electronic portal work will begin in FY23-24. There's a real estate assessment system also scheduled for 23-24, and also in that same window is land records. Our enterprise resource management system, which we call OnBase, is our document repository. We're looking to do a roadmap study in 23 and a modernization and cloud migration effort in 24 and 25. Prism, otherwise known as Oracle EBS, is our finance and HR system. Has quite a bit of age on it. We actually had booked and approved going forward with the full product replacement in FY21, and that was delayed due to the pandemic, and instead we did the technical upgrade, which was the vendor's requirement for compliance. So we'd like to see that go back on the books. We're supporting a large number of enterprise and department agency applications, much of which you hear about from the other departments. And we're in the background there. We're doing the hosting and kind of the heavy lifting work while they're doing the direct management of the software itself. Next slide, please. Funding changes. Funding for DTS, we do have some outscale years, and this usually is because of large software purchases. What was $9 million last year had a couple of extraordinary items in it. This year, there's $210,000 in PAYGO for courts, $2.1 million, which is predominantly the laptop first PC replacement program. And we're continuing other projects and point projects with funding balances that were carryovers from prior year. Next slide, please. In detail, PC systems and services, which is the desktop and laptop replacement program, substantially coming from short-term financing at $2.1 million. Some out of year network equipment and power system upgrades for about $90,000, a continuation of our server hardware and data storage refresh and an augmentation. Our data grows 15 to 25% per year, and our requirement to retain all of that almost indefinitely means that our server budget goes up quite substantially, our storage budget goes up quite substantially, and some of that will convert over the next few years from capital to operations, as much of that data is going to be pushed to the cloud. Connect Arlington, which is our fiber network, is funded by GO bonds. It is in year 2 of a 3-year small project enhancement. And that is primarily taking aerial lines to schools and burying them and dealing with problem intersections and other things that are not part of the DES improvement budgets in the right-of-way. The last piece is the $210,000 for PAYGO. This is for the upgrade of body-worn cameras to be able to display digital information in 2 additional courtrooms. As of today, we're operational for body-worn cameras in 6 courtrooms. We'll do 2 in FY22 and another 2 in FY23. Next slide, please. Final slide. Again, our focus here, since this is a must-fund year, is mobilization of the workforce and then being guided by what does our return-to-work policy look like. From a hardware horizon perspective, a lot more dollars are being spent on security apparatus and devices and software purchases rather than traditional network equipment. And that's important to understand simply on a year-to-year basis, because you will start to see the numbers shift where security becomes fundamentally more expensive and more important than regular network equipment. Finally is PRISM. We would like to get the Oracle EBS project back on the books whenever possible. And as you go through the CIP process this year, keep in mind that that is really one of the 2 largest enterprise software items that we have to deal with. And both of them are now aligning and will in fact cross in a couple of years. So the sooner we get one done, the sooner we can shift our focus to the other. Thank you. Questions, please.
Sure. It took me a moment to get off mute. Thank you for the presentation. We'll go to Mr. Dorsey.
Thank you, Mr. Chair. So, Mr. Sternicki, thank you very much. One question as it relates to, I'll wait a second, this echo will go away. Let's see if that works.
It did.
So for the body-worn camera program, the tech upgrades for the courtroom, for those lay people like myself, what upgrades are required? It's not as simple, I presume, as just taking a laptop and hooking it up to a monitor. What are we actually doing to implement the program in the courtrooms?
So there's a whole side of that that's happening over in police and is part of the public safety budget, and that is the collection of the information, how it is stored and archived and retrieved. This is really for display of multiple types of digital information, including body-worn, on monitors and systems large enough so that it is compliant with how the court normally operates. It needs to be visible in some cases by only certain individuals, or visible to the gallery of people, or visible to judges or whatever. So there's a lot of work involved in making sure that that can work and be repeatable, given that you have outside parties coming in to display information, as well as the information that we have in our body-worn archive.
So if I could follow up, Mr. Chair, is that largely display monitors? What are we buying? I'm just sort of getting a sense of what are going to be the needs for a refreshment schedule and what that's likely to cost and how that's going to impact our future budgets. So
it's about $100,000 worth of equipment per courtroom for the body-worn component. We have also upgraded for remote courts, putting in the collaboration software to allow things like Microsoft Teams to operate there. That was done separately and funded through CARES. At the same time that we were able to do that to 6 courtrooms, we were also able to bring body-worn forward there with some of the funding that was already set aside for that fiscal year. So that's what brings us up to date now. We will be complete in FY23. The replacement cycle on this kind of equipment, which is a mix of computer and audiovisual, is 3 to 5 years, and you would expect that to fall in price over the next 3 to 5 years. So I would suspect it would be significantly less expensive to upgrade the future.
Okay, thank you. I'll defer for other ones. If we have an opportunity for a quick round two, let me know.
Sure, of course. Mr. Karantonis.
Thank you, Mr. Chair. Thank you, Mr. Sternitsky, for the concise and very comprehensive presentation. I have one question that I'm trying to understand. So we indeed are moving all our equipment and the way we serve, work in Arlington County to mobile devices or devices that are hybrid. They're as well mobile and they can work as desktop devices at the same time. So this is a considerable cost, since these devices typically would be a little bit or would be more expensive than what we had before. Is there any part of federal funding or incoming expected federal funding that would still pay for that, or would help us to fund this transition? Because you're as I understood you're still also studying that. What is the new normal? How is the workforce going to come back, etc.? Could we take advantage of one-time federal funding coming now so that we could accelerate this transition?
We certainly should be looking for that if it's available, and I will contact my colleagues in DMF to follow up on that. What I can tell you is in the desktop world, you usually get about 4 years out of a desktop. You usually get 3 years out of a laptop. So there is an increased cost. As some of the offsets to that, where departments were actually funding laptops previously, starting last fiscal year, DMF actually helped us centralize this program so that we're making much larger bulk purchases, and we're able to now basically hand them out, almost same day kind of service, where we were not able to do that in the past. So we are saving some money organizationally, but we are going to have a slightly shorter system lifetime in the field, probably by 1 year. Although the equipment that you were all given recently, that equipment seems to be holding up quite well. We may be able to go past 3 years with that. And we're really not of the opinion that we will replace equipment purely on end date. We will replace equipment on end of life of the equipment.
Or of end of capacity to handle, some and cloud applications, etc., which I believe it's an additional risk factor that I don't see how, what is the expected, capacity life expectancy of a machine, basically, to handle more difficult things. Thank you.
Thank you, Mr. Karantonis. Ms. Garvey. And we will come back, Mr. Dorsey, as well.
Sorry, having technical difficulties with my machine. I'm going to ask a similar question to the one I asked before, and that is, so we have all of this equipment that's end of life, 3-year-old laptops or whatever. What happens to that? Because it's not all junk, right? They can get recycled. I mean, we may not recycle, but there must be an aftermarket of some sort for these things. So tell me what happens afterwards.
So a couple things happen. Large scale equipment, network equipment, and storage and servers, we try to decommission them and we use them as spares. A lot of it goes to laboratory equipment if it's still serviceable. It may be out of maintenance or warranty with the vendor, or we choose not to carry maintenance warranty on it because it's too expensive. If it is no longer usable to us, it goes out through a disposal process, which is run by the county, and I would have to go talk to my colleagues about how that's actually run. And it's also true with the PC program. They do go out and they do go for destruction because there's really no residual value left, and we have to do things like strip the disk drives out, make sure they're destroyed from a data protection perspective. I do not know if we have a resale program for computer equipment, but I will check.
Yeah, I would be curious because I think there's the sheer volume of electronics that just, there's got to be some things to do with it. And I know that there are, you know, shortages of chips and shortages of certain, you know, metals and all of that kind of stuff. So I'd be interested. I assume it's probably a developing field, but I would be interested in what we're doing. Thank you.
Thank you, Ms. Garvey. Mr. Dorsey.
Sure. In the same vein, when it comes to mobile computing, I would hope that Arlington is, you know, providing insurance or getting insurance on these devices, unlike what we had to do when everything was a desktop to account for spillage, drops, theft, and all the rest. How much of an impact are those insurance costs impacting our operating budget?
They are actually carried, in this case, I believe, as part of the capital purchase for the life of the equipment. So particularly on the laptops, which have a short life, you know, a 3-year life, I believe that's according to GAAP and government standards. So they are covered for their lifetime, and those replacement programs are, you either go to DTS and we'll hand you another one, or if, in the event that you were out of town, you could actually go to the vendor of the equipment. I won't say who, and they will provide you the replacement there.
All right. So these are all in costs that you give us that account for all of those other things like
Correct.
insurance.
That's correct. Now we are looking each year at what the value would be of self-insuring and just dealing with spares. A few of my colleagues and myself have done that elsewhere, and we're trying to understand, you know, what the savings would be if we did that and what the risk factors would be. That's a
little bit of savings, a lot of aggravation.
Correct. There is a point where the two cross. It's not always where you want to be on the chart, though.
Thank you, Mr. Dorsey and Mr. Stranitzky, for your presentation, helping us with the questions, and also your service and your team's service to the county. I'm glad you mentioned PRISM. That will be on. It was on my mind. It will be on our minds as we go into the CIP process. So thanks very much. I don't know if you have particular thoughts on PRISM to close, but I did notice that, and I think it's on all our minds, whether it's a one-time eligible type funding or whether that might be a little further down the road. But thank you very much.
Thank you.
Any closing thoughts?
I only that we would like to move forward with that project. It touches so many different systems and processes and workflows throughout the county, and it can do more. The new system has many modules that we don't have today that would benefit finance, benefit HR. It is probably out of all the things that I can think of out there, the best long-term software investment we could make would be to move that project forward.
Great. That's very helpful. Thank you. I hope that Mr. Manager heard that via phone, or we will also follow up ourselves. But thank you for the presentation very much. And we will go next, I believe, coming down towards the end, we have of our capital day today on the budget. We have next transportation, and I believe it's Mr. Leach.
Good afternoon, members of the board. It's a pleasure to be with you. I am Dennis Leach with DES Transportation, and I also have Sarah Crawford, our Assistant Director of Transportation, with us, and Bajatha Huffman, who is our Transportation Capital Funds Manager, available to answer questions. I'm going to be covering 3 different funding programs this afternoon. The first is PAYGO Capital. The second is the Transportation Capital Fund. And the third is our taxi rent financing across Pentagon City, Crystal City, and Potomac Yard. Next slide. So Arlington has a rich array of transportation assets that support our community and provide our residents, workers, and visitors with many different travel options. But these assets require ongoing investment. Next slide. Just covering a little bit of snapshot of the last year. We continue to deliver services and advance plans and projects across the organization. Some parts of our program actually became more efficient. We saw greater efficiency in electronic plan review, our permitting operations. We actually issued more permits during the COVID year than in prior years. We also saw some efficiencies in our capital project delivery due to a reduced level of traffic on our roads. We extended work hours both for county projects as well as developer projects. And our staff also took on additional assignments to support the community during COVID. While these were operational in nature, they tapped many of the same staff that are used to deliver our projects. And this is particularly true in our Transportation Engineering and Operations Bureau and Transit. And I've just listed a couple of those program initiatives, the most recent being a full court press to help APS get back to school. Next slide. So first, I'll address PAYGO Capital. PAYGO is a very important source of funding to support the maintenance of our assets across the county. The manager's FY22 PAYGO request is really focused on just two areas in terms of new funding, and that is paving and bridge maintenance. The proposal is to use our balances to actually fund all other program areas. And this is really viewed as a one-year strategy. Next slide. And so the PAYGO budget changes, you can see in FY21, we were at 2.975 for the revision. It's a little bit lower for FY22, really focusing on those two areas. And in GEO bonds, the full GEO bond request will be evaluated as part of the CIP deliberations in the summer and the fall. Next slide. And so this captures the funding proposal. You see $788,000 for bridge maintenance, a critical maintenance function. We've internally reallocated balances from other program areas to support the three asterisk areas. Street safety improvements, very important as we advance Vision Zero, and some commitments in both Bike Arlington and our Neighborhood Complete Streets programs. All other areas are proposed to use existing balances. Next slide. And then on to the paving program. PAYGO Capital is incredibly important for certain types of paving. Our slurry seal and microsurfacing, we only fund that through PAYGO Capital. And then you can see the GEO bond, which is the existing approved bond. Our paving program is funded on a calendar year versus a fiscal year. And so we will be coming back for another request for additional GEO bond approval. Next slide. Paving is an asset that is incredibly important to the community and is ranked pretty high in our citizen surveys. We have been making substantial improvements in pavement quality, but it does require ongoing investment. Next slide. And then just briefly touching on bridges, we have 25 vehicular bridges, 11 pedestrian bridges. We do inspections every 2 years, and our goal is to maintain a level 6 or 7 rating. But again, that requires ongoing maintenance. Next slide. And then there are many other assets, everything from our signals and ITS infrastructure, our cameras, to our many streetlights, to the over 100,000 signs in the right-of-way, to our over 5,000 parking meters. All require ongoing investment. Next slide. So I'm next going to shift to the second transportation fund in this presentation. This is our Transportation Capital Fund. This slide highlights some of the work during the calendar year. We completed Clarendon Circle intersection improvements at sort of the beginning of the COVID experience. That project was brought in slightly under budget at $4 million versus $5 million in the CIP. At the eastern end of our Roslyn-Ballston corridor, we completed the Lynn Street Esplanade and Custis Trail and Lee Highway improvements. That project finished up in May and came in on budget. And then down on Columbia Pike, the project extending both utility undergrounding and streetscape improvements from 4 Mile Run to the county line. We reached substantial completion of the infrastructure investments. In the fall, we still have some items like the final undergrounding of those utilities coming later this year. And then we have some current construction as well. Ballston Station, which was first built in the late 70s, We started the total rebuild of that, and that construction started in June. Next slide. So our Transportation Capital Fund is composed of two different funding sources. Our local commercial and industrial tax, or called C&I tax, which was allows the legislation allowed us to raise that tax. It will generate approximately $24.9 million in FY22. Because this is specifically on commercial property, we did see a reduction of 4% from 2021. The second component is our NVTA local, which is a 30% local allocation from House Bill 2313. That revenue source is actually up in FY22. It's 15% higher. The key driver was increase in the sales tax and a reinstatement of a portion of the grantors tax. Next slide. And we have a lot of construction in calendar year 21, from Ballston to Glebe Road to Columbia Pike to investments in Crystal City and Pentagon City. Next slide. In terms of the budget summary, we are projecting a slight increase in spending in FY22. We do expect revenue to drop a little bit, 1.4%, and the staffing level for this program is shown as increasing 5 FTEs, which is a transfer of program managers from the general fund to the Transportation Capital Fund. The majority of their costs were already covered by capital projects, so this is transferring the balance. Next slide. And the fund balance, including grants, we started in FY20 with 135.9. We did a reestimate, and then you can see the proposal. The fund balance is affected by when we expect grants, and you see grant revenues up dramatically in FY22. We use our Transportation Capital Fund to leverage outside funding sources, so state and federal grants, funding from NVTA. Next slide. And the same is true with our Transportation Capital Fund NVTA local portion. We are estimating that we will be spending about the similar amount, but again, a substantial increase in grant revenues. Next slide. And then we also have operating costs in our Transportation Capital Fund. So it's not just for assets, but it's also for new services. And these costs are ongoing. The percent of TCF revenues directed at operations is increasing. It went from 17% in FY20 to 18% in FY21. Our projection is for 20% in FY22. And that's driven by two primary factors. One is it reflects the full impact of the higher cost of our art operation and maintenance contract that went into effect. And it, to a lesser extent, it reflects the transfer of those 5 project managers. Next slide. So I'll next shift to our third funding source this afternoon, the Crystal City Tax Agreement Financing. This was created by the board in 2010 to implement the Crystal City Sector Plan. It does cover all of Pentagon City, Crystal City, and Potomac Yard. And the fund is used to provide critical transportation and open space infrastructure needed to support redevelopment in this area. Next slide, please. And just to highlight some of our TIF area projects, we currently have 23rd Street from Eads to Route 1 under construction, a major area that is a focus on improving accessibility and safety. We did remove elevated Clark Bell. We finished that project in 2020 and brought it in substantially under budget. And then we are advancing the work on the transitway from Crystal City to Pentagon City, and we just approved the 100% plans for that extension through the north end of Crystal City over to the beginning of Pentagon City. Next slide. And this just highlights some of the projects of note in Crystal City and Pentagon City. On the Complete Streets side of our portfolio, we have Army-Navy Drive Complete Streets, which is rebuilding Army-Navy Drive along the whole frontage of Pentagon City. We have Boundary Channel Drive, interchange rebuild, which is a partnership with VDOT. They will deliver that project on our behalf. And then the board just approved the A&E contract for the NEPA work, environmental policy review work, as well as concept engineering for the connection between Crystal City and National Airport. For transit, we have the extension of the Transitway, which I mentioned, from Crystal City to Pentagon City, and we also are advancing work on the Crystal City Metro second entrance. Next slide. The summary for TIF, we're estimating slightly lower expenditures, marginally lower. This funding source, because it is geographically limited to Pentagon City, Crystal City, and Potomac Yard, is more volatile than our Transportation Capital Fund, and it did see a substantial decrease in revenue in FY22. Next slide. And then the fund balance, we're projecting a fund balance of 24.1 million and a closing balance of 22.4. Next slide. And then key budget considerations for all three of these transportation program sources. For PAYGO, the request is really limited to critical state of good repair needs where existing balances were deemed to be inadequate. Select unfunded requests met with existing funds that we reallocated from other areas of our program. And as I mentioned earlier, we view this as a one-year strategy only. It's not sustainable in the longer term. On TCF, our Transportation Capital Fund, this is a fund that is critical to make investments across Arlington, and we use this fund really to leverage outside sources like NVTA, regional funding, or state grant applications. And then finally on TIF, geographically specific, the county board sets the rate annually. The initial rate was set at 33%. It was reduced to 30% in 2018 and 25% in FY 2019. The county manager's proposal for FY22 is 25% rate, and that is part of your deliberations. And with that, I'd be happy to answer any questions that you have.
Thank you, Mr. Leach, for going through quite a number of slides and material quickly to give us a sense of things. Certainly, we may follow up with questions. I think I just have one broad one, which, you know, the transportation along Columbia Pike, just to sort of a plug, I think you've considered the less traffic in the coming months and more later. It's an opportunity to try and do some of the construction projects sooner, and I'm thinking of the bus stops. I know it takes, you can't just on a dime accelerate, but you have thought about even within this year as we get more vaccines out, like Metro has done, we're taking the opportunity where there's, in addition to Clarendon Circle, where there's a chance to get construction done soon and perhaps reduce costs or reduce traffic later. Just confirming you've thought this through as a department and a team.
Absolutely. We took full advantage of reduced traffic across the whole calendar year, and we continue to look for opportunities to accelerate construction, to limit disruption later on. And we did this not only for our own capital projects, but the development community benefited throughout the year by extended hours, both during the work week, extended hours on weekends, looking at more aggressive lane closures where it would not be overly disruptive. So we're always looking for ways to advance the program.
Thank you, Mr. Leach. We'll go to questions from colleagues. I think it was Mr. Dorsey first, and then Mr. Carantonis.
Thank you, Mr. Leach. I'll put an early plug in for something that I hope you can produce by the time of the CIP in conjunction with DES. And that is really a look at our PCI with the averages disaggregated so that we could see among various roads, those are, you know, at the high end of the spectrum, those at the low end, and all points in between. My question for you on this day is, what is the best practice that you are targeting for determining how much of the TCF to devote to operating costs? Presumably there's a number there that you don't want to tip, otherwise you're having significant systemic issues. So what are you looking at?
It's more of an art than a science. There is no exact number. I think we as a staff really reviewed that in some detail in preparation for this budget. And we've certainly looked at it very carefully. We're working on basically spreadsheets for a 10-year CIP because some of our projects extend beyond the 3-year horizon that you're going to be acting on. So we've looked very carefully at that. I think we as a staff are comfortable recommending to the manager and the board 20%. I think as it creeps up beyond that, we would have to really evaluate what it means in terms of delivering the program, leveraging outside funding sources for priority projects.
Okay, thank you.
Thank you, Mr. Dorsey. Mr. Karantonis.
Thank you, Mr. Chair. Just quick, it helps me just structure my mind around what to do, what we will have to do, or how to work with federal funding. So in what you presented, Mr. Leach, and thank you so much for the, again, concise but very comprehensive presentation. In all this, do you anticipate one-time funding coming from federal sources in this COVID stimulus? Do you expect any relief, any injection of funding that will help us there, either in operations or in aspects of capital investment?
Well, I will answer that first by saying that most of the activity has been on the transit space as opposed to our Complete Streets program. Metro is still working through CRISA, which was the federal legislation that was passed in December, and what that means for both themselves as well as for localities, and what funding may be provided to Arlington for local transit. And so I would say there's still a whole lot more work to be done on the most recent federal legislation. And again, that is worked with Metro and all of our regional transit partners. But I do anticipate that some federal funding for transit operations will be coming through. We also are tracking what's happening in terms of proposals for federal legislation, what kind of infrastructure bill might be on the horizon for the upcoming calendar year. At the moment, we have a really relatively modest level of federal funding in our capital program, mostly aging earmarks that are we're trying to spend down in the next year or two. But we are providing input in terms of some thinking about the upcoming infrastructure bill.
Thank you so much.
Thank you, Mr. Karantonis, and good to hear, Mr. Leach, regarding the upcoming infrastructure bill. Certainly, we will be following it, given our interested community in federal steps, and we'll be following it for the county's future infrastructure needs. We really appreciate all the work, and thank you. I know there's a team with you that is also helping, and your longstanding commitment to the work. Very much appreciate it. We will go on to Metro. Thanks again, Mr. Leach.
Thank you very much.
We have, I believe it is, with respect to Metro, I believe it's Mr. Freeze, Jason Freeze. I think you're popping up. Yes. Thank you, Mr. Schwartz, for helping me along there. And Mr. Freeze, I think you are present. Go ahead. Thank you.
Thank you, members of the board, and good afternoon. Briefly, I'm just going to present to you the last item for this evening, which, as you mentioned, is the WMATA operating budget for fiscal year 2022. So as you're aware, Arlington County is a jurisdictional funding partner of Metro, and we are responsible for funding the operating and capital needs of the agency, net of their fare box and other revenues that the system receives. This includes the Metro Bus, Metro Rail, and Metro Access programs. Now, historically, this has represented or resulted in the county providing about 6 to 8% of the region's share of funding for the system. Due to the pandemic, WMATA's revenues have seen significant reductions since March of 2020. Fiscal year 2021 revenues are currently on track to decline over 75% compared to fiscal 19, which was the last full year of service prior to COVID-19. There have been significant reductions in bus and rail service that were implemented in order to balance the budget in fiscal 2021. And as you all are aware, the federal government has approved, now there are 3 rounds of pandemic-related relief funding, which has included revenues for transit agencies. The first 2 rounds of funding allowed WMATA to relax those planned service cuts used in fiscal 2021 to balance the budget and reduce planned layoffs and maintain service levels at levels sufficient to meet service demand. WMATA's fiscal 22 budget is looking slightly better than fiscal 21, but it's still going to see significant impacts from the pandemic as ridership slowly rebounds to a projected 31% of the pre-pandemic levels, so still very low. The general manager at WMATA originally proposed a budget that included $515 million of the remaining federal funding from the CRISA, the Coronavirus Response and Relief Supplemental Appropriations Act, that was not needed in fiscal 2021. These funds filled the revenue gap from lower ridership for the first half of fiscal 22, so not the full year in WMATA's budget. But this allowed WMATA to maintain local jurisdictional subsidies for all jurisdictions at only a 3.7% increase year over year. However, the GM's budget, as I mentioned, assumed a significant $210 million gap in the second half of fiscal 2022 once federal funding ran out from that CRISA funding. Originally, that was going to be resolved through some management actions and a significant reduction in bus and rail service. I think it was about 30% of rail and 50% of bus service was planned to be run starting January 1 of 2022. Fortunately, after the general manager released his proposal in this past March, the American Rescue Plan was passed, which provided the 3rd round of federal funding for transit agencies. We don't know yet what that exact amount is for Metro and what, if any, of that will come to local transit agencies as a portion of that funding. But it is expected that funding will fully address that $210 million gap that WMATA had left in their budget and will eliminate the drastic service cuts that were planned and hopefully eliminate any potential for a jurisdictional request for additional funding. Now, looking at Arlington's budget specifically, general fund support is declining or expected to decline by 2% in fiscal 22 to $46.6 million. And this is due to an increase in available state transit funding for WMATA operating. While the 22 funding remains relatively flat, the next few fiscal years present a real risk as the federal funding expires and ridership slowly returns back to normal. Any continued reductions in ridership compared to those pre-pandemic levels may present significant budget pressures for Metro and the local funding jurisdictions going forward. What I can say is that staff are working closely with WMATA on this issue, and as we start getting into those discussions, we'll update the board as that information becomes available. So with that, I'll open it up to the board for any questions, and if not, we'll hand it back to Mr. Schwartz.
Thank you, Mr. Fries. Questions for colleagues? And Mr. Dorsey, go ahead.
Good to see you again, Mr. Fries. So given that there's so many uncertainties and risks moving forward when it comes to Metro ridership, which is, such a big driver of subsidy, and you can come up with all kinds of scenarios that it'll return quickly, take forever, never even get back to the new normals we were recently enduring. Are there things that we should be thinking about with our budget in order to help sort of shock absorb for those risks, which could result in a huge year-to-year ask once all this federal stimulus expires?
I do think we will be looking at in our multi-year forecasts. As you know, we do fund Metro with a combination of funding sources. We have state transit aid that comes to the region to fund Metro, both capital and operating. We have gas tax revenues that go towards the agency, and then we have the general fund support. We will be looking at. That's why we're very anxious to see, especially this calendar year, how the ridership rebounds. I think we'll be, anxiously awaiting that data as it comes through, and it'll help guide us in looking at what is the appropriate level of support for Metro. What I can say is that we do have, some additional funding at MVTC state aid balances. We don't fully use all of our balances. We keep a little bit for this exact reason, so that we can hopefully endure some small shocks to the funding or required funding for the system. So we are hopeful that that helps us, but I do think that will be a point of stress as we look forward in our operating budgets.
Appreciate that. Thank you.
Thank you, Mr. Dorsey. I believe it was Ms. Garvey, then Ms. Crystal.
Yeah, just a continuation of the same subject, and nice to see you, Mr. Freeze. See, once a year kind of. Is there much conversation? I don't know if this is for you. It's maybe even for my colleagues. Maryland, the state of Maryland basically funds Metro, not the jurisdictions, whereas in Virginia, it's just us. Is there any talk about, as we get to this uncertainty, I see my colleagues smiling, shaking their heads. Anyway, I just kind of open up that issue. I keep wondering if we ought to be working on that a little bit to be getting more help from the state rather than having it all on our shoulders.
I think defer to the Northern NVTC chair.
Well, I don't want to step on Mr. Freeze's toes. I will say it's not accurate to say that it's all on our shoulders, right? As Mr. Freeze was noting,
no, exactly.
NVTC is not insignificant. And in fact, I don't know, Mr. Freeze could speak to this as the sort of budget continues at the state level, but my understanding, we asked for 30 million, we got 10 in an increase to localities for state aid for Metro. So I don't know if that'll, if there's talk about how that will play out through our own budgeting process, but no, there is no appetite at the state level to take on a greater role for Metro. We are fortunate at the least that they were at least willing to take on a greater role in capital. As you'll recall, that was the major effort in 2018. And as those of us who lived through a CIP or two, and you lived through more of them than I did prior to 2018, know, just those wild swings in the capital asks on the localities. We had a year when that was really challenging for our ability to fund things like school capital improvements, et cetera. So the state playing a role in a dedicated capital fund is really important as well. But in terms of those local subsidies, I don't think there's any appetite. I would say, I'd be interested in Mr. Freeze's take just to the prior really helpful discussion. There are so many legislative exclusions to the 3% cap in jurisdictional subsidy increases year over year that, at times it's when you look at how our budgets or our subsidies have actually increased since its adoption, they look closer sometimes to 6%, et cetera. But I would have to imagine that cap would protect us from the kind of situation where in order to deliver current levels of service, Metro comes back to us with an ask for an 8% increase year over year, et cetera. They would have to make that ask in context of the legislative exclusions to the cap, the Silver Line coming on board, new service approved by the Metro Board, et cetera. I don't think there's much path, although Mr. Freeze and Mr. Dorsey may have insight, to them coming back to say, actually, your bill has increased by 7% this year to deliver the same level of service, even if there are revenue losses. Frankly, what worries me and what we saw, during the kind of back and forth about, up until there was federal relief for transit and up until there was more federal relief for transit, is just serious slashes in service, which affect Arlingtonians, in a different way, but as much as real increases in our budget. So I don't know, if Mr. Freeze and Mr. Dorsey both have some expertise in that, but to what extent the cap would protect at least our budget from Metro coming back to the jurisdictions to ask for more contributions to deliver the same level of service if ridership continues to decline, doesn't come back to 2019 levels, et cetera.
I think I'll let Mr. Dorsey comment because he knows far more than I on all of these issues, but I think there's some traps built into the Metro Compact. It's matching with, I think, if ours goes down, I believe Maryland's goes down too, I think. if we're not, I think, I could be wrong. So I'll let Mr. Dorsey talk about that. And then, Ms. Crystal, I absolutely agree that there's probably no appetite now, but I do think Metro's going to be here for a long, long, long time. And I think it's something we need to kind of keep working on. It may take years and years, but eventually I think it would make more sense if we're more on equal footing, where the state steps up much more in the mode of Maryland, rather than having our jurisdictions have to carry it all the time. So just a long-term project that might be worth kind of pursuing, but not expecting any success soon. So now I'll turn it over to Mr. Dorsey or whomever, Mr. Chair, because as I say, I know Mr. Dorsey knows far more than I. Thank you.
Well, Mr. Chair, I would, it'll be a great exercise to see if Mr. Freese and I still have the same synergy, to let him start off with the overall, and then for me to maybe highlight a couple of trapdoors that could impact the jurisdiction.
Mr. Freese.
Sure. So, I mentioned the legislative cap has actually been fairly useful the last couple of years on the capital side and the operating side. It's helped us maintain more of predictable budgets, which has been great. As you mentioned, we got hit with a couple significant, in the 11, 12 years now that I've been with the county, 1 or 2 significant capital requests, which, as you know, capital is we pay for with bonds, but that does have a debt service impact, which flows to the general fund. So it did, have a big impact on two of our CIPs in the past, and that I think has happened in the past. So it has helped there. And there are some exclusions, like you said, the silver line, other legal and contractual type obligations, which is why even this year, the increase is 3.7%, I believe, on a net basis at WMATA. And that was because of the full implementation or planned implementation of the Silver Line Phase 2, which I believe is now delayed a little bit more. But 3.7% is much better than some of the 10+ % we had in historical years where ridership was declining and expenses were increasing. So it has helped. And I do think that, as you mentioned, that 3% cap, WMATA is trying to adhere to it. So to the extent these revenues were declining, as you saw in the proposed fiscal 2022 budget, we were still managing to at most a 3% subsidy increase. And then the next turn was reductions in service, because there was, when the federal funding ran out, there was no more revenue to fill the gap. So I think that would be, the starting point from Metro's perspective. However, the jurisdictions could, seeing that if there was in the future a significant drop in revenue that was unfunded and a large gap in their budget, I think it would be that the jurisdictions would have to choose to go over that 3% versus being given a subsidy from WMATA that's over 3%. That it would be our decision. So I think that's where it is now. Mr. Dorsey, I don't know if that's maybe the line of thought you're thinking as well. But my thought would be, if it was significant enough, we wouldn't. I don't know if as a county we would be on board with 20% of Metro service and being able to, would that actually even meet the needs of our residents, which I think not. So it would be a big topic of discussion of what do we do there.
Yeah, the synergy is exactly there. I mean, I'm assuming that at the end of the day, we're not going to accept a dramatic cut in transit services, and that could be the shock, depending on how the numbers play out. So we'd either have to have a difficult hurdle to find a way to provide a lot of money for the service, or decide to go without. Either way, it's either a huge fiscal or a other kind of cost. And Ms. Garvey, just for benefit of your question, I can't say that I have any high hopes that it will happen, but it's probably a higher likelihood, Ms. Crystal would agree, than the state providing more money for Metro operating. There is an effort from the Council of Governments to make the case to the federal government to finally get involved in operating funding, which could provide a level of relief. Clearly, the construction of the Congress and the administration, the stars are aligned for that like never before. So fingers crossed that that's successful.
Thank you, Mr. Dorsey, and really helpful, Mr. Freese. Full credit to you for analyzing it all when you've got a couple of folks who've been engaged as well. So thank you, Mr. Karantonis.
Yeah, thank you, Mr. Chair. I have to ask, Mr. Dorsey's concern about the risk that's embedded in all this is very significant, and I believe that until now, and one of the new ideas that I hope that we will be discussing also with the federal government, with the new administration, will be how to strengthen the metro systems own ability to manage its own risk. So to make them more resilient as an organization, as a service provider, so that we don't have to face the risk at the full. So it will be the federal intervention will be critical to rebalance the risk as we go. But still a lot of imponderables ahead. Very, very small question. Mr. Fries, thank you for the presentation. I don't know a lot about the current status of the gas tax. You budget that with $1 million. So what is to be expected there? Last time we got twice more than 2.5 times this. So what is there? I understand it's a minimal and very antiquated and not updated financing input here, but what should we expect from gas tax?
I was just updating that last week and taking a look. We pay Metro quarterly, so I was updating my projections to understand where we sit with our balances. And I believe for, if I was to predict for the full fiscal year of 2021, I think we're I want to say it's between 1.1 and 1.2 million dollars is the total that I believe is going to come in this fiscal year. It's getting to be springtime. As people as restrictions start being relaxed, people maybe start traveling out more, maybe gas taxes will pick up. But that's where I think we are right now, is just above that $1 million mark. But as you saw, in historical budgets, we usually funded about $2 million or more, depending if we had additional balances. So it is a significant hit. But I am hopeful in the future fiscal years that we'll get back to historical levels.
Thank you.
Thank you, Mr. Karantonis. And I believe that concludes the work session, unless I don't see additional questions. We have had a thorough discussion of capital and in this work session. Thank you, colleagues, and to the manager and all staff. Appreciate it as well. For today, we are adjourned.